times on WACA television. Is anybody else recording? Seeing none, I will open it up to citizens' participation.
And good evening.
Good evening.
How else would you open a meeting up without me here?
Huh.
Welcome to almost the end of a interesting year of in and outs of action and Board of Health rebounding well by the end of this year with all the starts they had. I agree in two things I hope the board will work on, which they are going to talk about. One of them is going to be the budget, and the other one's going to be the Homeland Health alerts by Mr. Health Agent there. Mr. Orr is going to talk about. Those two things are important to talk about.
Mr. Health Agent. I like
Ms.
that.
Health Agent. Or Mr. Mark, should I say. That's right. Okay.
It's a good
And
name. Mark's a good name.
two Marks don't make a right sometimes. And I'll make this quick and make it quick as easy and simple. Coming up, Thanksgiving went by well, hopefully for all. Christmas is coming up and New Year's is coming up. And so hope we go through the town without any sort of mistakes or hiccups to make the end come good and make the new year come in better. Thank you.
Thank you, Mark. Appreciate with that. One thing, and it's not on the agenda, but I'll do it under maybe my citizens' participation. I think it would be remiss if this board did not acknowledge the fact that the flags are at half-staff, and tomorrow is the National Day of Mourning in remembrance of George Bush, the President of the United States. I think if you all, you don't want to talk politics ever at a board meeting, but nice man, kind man. And if you're not a lover of politics, but you just want to learn about a good human being, I would encourage anybody who hasn't had the chance to do that to look at it. And I find it interesting. Like I said, we don't want to talk about politics, but one of his best friends is the man who defeated him and knocked him out of office. So it's proof that good government takes a lot of compromise, and I think you have to be more of a caring person than you do have to be a bully. And I'll just leave it like that.
Well, yeah, I mean, if I can just add one commentary to that, is that beyond politics, it's a piece of modern history. And, we all lived through his presidency, and the kids of today, that's, the closest they had to who were the surviving presidents while they were alive. So, watching history move is part of the process of living history, so.
Well said, well said. All right, seeing no other parts of citizens' participation, we'll move right to our tobacco control regulation review, and I just want to give a shout out to the board, because maybe the board isn't aware, but they certainly will be by the end of Chris has done a phenomenal job. He's gone above and beyond and done a lot of research, and I want to thank him for that. And with that, I'll turn it over to Chris.
Thank you. Okay. I'm going to keep this relatively short tonight. Based on our last meeting, with decisions at every turn and some of the stuff we discussed, I set out on a mission, as I mentioned, to contact our neighboring towns to kind of get their pulse and see how willing they were to work with us. And so I contacted Holliston, Hopkinton, and Southborough and sent them all the exact same email. It says, I am a member of the Ashland Board of Health. We are currently working on revisions to our tobacco regulations and wanted to request a copy of the current regulations from our closest neighbors. We'd be happy to provide our current and eventually revised versions to you as well. One of the hot topics is considering banning of mentholated cigarettes in addition to other flavors. We understand Somerville and Needham are considering something similar, and we were curious if our closest neighbor towns were or would consider this as well, and if so, consider doing it in unison. And Lisa Deering from Holliston responded to me, and she sent me copies of their current regulations, and effective 1/1/2019. And she mentioned in Holliston, the board did discuss the ban of menthol and flavors and decided against it. She also mentioned that their new regulations cover the ban of use in public places and restricting the sale of tobacco and related items. and opened up that she'd be there for us if we had any questions. In Southborough, I got a response from Paul Pazinski. And his response was that they've been working with the group Metro West Health Foundation and the Regional Collaborative Tobacco Control Program, which they mentioned Mark was also
I was at the
involved with.
meeting Last Friday.
And hopefully, they're looking to partner with 8 towns that are being discussed in there, plus the city of Framingham. They're not sure what their issue, where they are specifically at this moment with the issue of banning on flavored products. And they're in a position where they lost their paid director who was collaborating and coordinating with joint efforts, and referred me to someone from Natick as well to talk. And in Hopkinton, I got a brief reply from Sean McAuliffe. They were having some problems at Town Hall with power at the moment, but the short answer was that they were looking to adopt the model regulations eliminating flavors and capping the number of tobacco establishments.
Did he give you a time frame?
He didn't at the moment. He did say he would get back to me. I haven't heard back from him, and I haven't had a chance to get back to him yet. So those were the 3 communications I have. I do have copies of all 3 towns' current regulations as well, which my goal from this point would be to review and put together a second draft of our regulations based on that.
So can you scan those to Laura, and then
Absolutely.
Laura can then distribute to us?
Yep,
and
I
then-
will certainly get them to Laura.
No, we do have a guest here tonight. I think this would probably be a good time, sir, if you want to come up to the podium. For legal purposes, you have to tell us who you are and where you live.
Yes, good evening. My name is Adam Ponte. I actually live in Belmont, Massachusetts. I'm an attorney at the law firm Fletcher Tilton, and I'm here tonight on behalf of 2 associations, the Coalition for Responsible Retailing and the New England Service Station and Automobile Repair Association. They go by NASARA, and the coalition goes by CRR, so I'll abbreviate. These are 2 groups that basically look out for the interests of small business owners, like the convenience store owners you have here in town. I had the opportunity this afternoon to make one stop over at 5 Homer, the small market there on the corner, and I met one of the owners. Her name is Raj, and I think that one of the big things that we do is we monitor agendas in various local towns, and we talk with local store owners to let them know about proposed regulations, proposed bans like the ones that you guys just referenced, and talk to them about whether they're aware of whether it may or may not have a detrimental effect on their business. So tonight I'm here on behalf of the store owners, and unfortunately I didn't have the opportunity to get them all to come, but I understand there's no vote happening tonight. This isn't a public hearing, so I figured it would be more productive for me just to speak directly to the board. But just to speak in opposition to any proposed ban on menthol, mint, and wintergreen products. And I'll have 3 primary reasons that I want the board to focus on, and I'll also talk about 2 towns. One is Needham, and another is Marion. And I'll get into that in a moment. But just a high-level overview, our position, respectfully, is that a menthol ban doesn't, in practical effect, benefit the children and youth in the town. Furthermore, and I know this would be a completely unintended consequence, but there's been prior litigation in the past, actually in the city of Boston, that runs corollary to a menthol ban. It would be a cigar wrap ban, and I'll talk about cigar wrap litigation, and there were actually allegations of unintended racial discrimination against protected classes of individuals who prefer those products and would be prohibited from now buying them. And it could expose various towns like Needham or Hopkinton or Holliston to potential claims at the state and federal level for racial discrimination. And the last part is, it's sort of a contention that the ban is almost arbitrary, right? And that's because of recent studies that have come out from Vanderbilt University and the National Cancer Institute, that there is no different health consequence as between using mentholated products versus regular tobacco products. So stated differently, as there's no different health consequence if you were to smoke a menthol cigarette or a regular cigarette. And the last point that I will discuss, it's your store owners here in town. They're your gatekeepers. And actually, this town has a 98% compliance rate, which is remarkable. So I think you have 20 or 21 retail locations that sell tobacco products. 98%, 18?
Yeah.
98% compliance rate. So you have these store owners who are investing their time, their money, their resources into making sure the clerks who stand behind the counter, when they have patrons who come in who want to purchase those tobacco products, they make sure that they're not selling to the minors, to the youths. They're trained. And they know that these patrons, they can't come in like alcohol and actually touch the products. It's behind the counter. You can't access it yourself. So I told you that I had 3 primary reasons that I want you to focus on, because I don't want to rattle on here. But the first, it's what I alluded to at the outset. It's that this regulation could have the unintended consequence of creating discriminatory animus against protected class of citizens. Recent data has shown between 84 and 88% of African American tobacco users prefer menthol products. And I talked to you earlier about the town of Marion, Massachusetts, right? They actually did not move forward with a ban on menthol products, and that was one of the primary reasons. And they actually found persuasive a presentation by the Massachusetts Minority Police Officers Association, and they talked about how if you were to take away these products in larger communities, it could result in black market, aftermarket sales out of vans, out of trucks, because people are going to find ways to get it, and those types of transactions do support crime, and it could create new problems for police, law enforcement. Now, you also may hear, though, on the other side, NAACP actually supports a menthol ban. So you're saying to me, well, then how are you talking about discriminatory animus towards a protected class? That's because groups like NAACP, they're national organizations. They're not here on the ground. They're not grassroots. They're not talking to local communities here in and around the city of Boston. So that's sort of the first point, that we contend that this type of ban could result in exposure on a state or federal level. You could have the protected class of individuals who prefer that product saying that they're now, almost 9 in every 10 smoker, African American, prefers menthol products. The second, arbitrariness. So I want to talk to you about how the National Cancer Institute and Vanderbilt University came out with studies recently that there is no different health consequence between the products, regular and menthol. And importantly, you may have heard about the FDA's recent memo. Commissioner Gottlieb came out mid-November, and he said, I am pursuing and supporting bans on flavors. Vanilla, mango, cherry, all those flavor products. He said, kids want them, we're taking them off the shelves. I want local towns, I want it off the shelves. But he explicitly said in his memo that he is not acting at this time on the menthol, mint, and wintergreen products. Why? He had 2 reasons. The first is because it's been proven adults 21 and over, they're the ones that prefer the menthol, the mint, and the wintergreen products. More importantly, those products provide an avenue for the adult users to transition from the combustible products to the safer non-combustible products. It provides them an avenue to leave those less safe products because of those flavors to the non-combustibles. So the FDA is not acting on it. And so just like we've discussed with the town of Needham, we're asking local towns to not act ahead of the FDA, where the FDA has the resources to look at the impact on different protected classes. They have the resources to look at the actual adult users and transition avenues that they can have. So that's my second point. The third, I ended in my intro, it's the store owners, right? So I only had the opportunity today, I had a little bit of short notice about tonight's hearing, but I spoke with Raj over at 5 Homer Ave, and she was horrified. She said, well, we know that we can't sell the other flavored products here, but she goes, I can get the data. I think half of my tobacco, my cigarette sales are menthol. And she said to me that it's possible that the other store owners in town, it's the same. And although it might not be all citizens of the town of Ashland, you have a lot of service workers who come through town and they stop in the various stores or gas stations to purchase products. They're buying these products, and that's money that these families use, to raise their children here in the community, to pay their taxes. And I think it would be highly detrimental on them if they were to lose the ability to sell these products. So for those 3 reasons, I just wanted to educate the board tonight. I'm here to answer questions. Director Orem has my contact information, and I'd be happy to answer questions now.
You guys have any questions?
I would like to bring up 2 things, just respond to 2 points that you made. One, relating to the menthol products, your statement was that there is no evidence that menthol products are more dangerous. I don't think at any point, any of the discussions we've ever had mentioned that was the case. That's probably the truth. The fact is that menthol is a flavor, and there is evidence that menthol and flavored products make getting addicted to nicotine easier. And that is the concern that we have, and that is why we would move ahead to ban it. And then the other comment related to our store, our proprietors in town. I love our proprietors, I respect our businesses, I support them 100%. But if the reality forces me to make a decision to save the life of our children and our youth and our citizens over protecting a business, I will save lives every time.
So if I may, I have a brief response.
Sure. Friendly conversation.
Of course. It's a very fair point that you make, right? Vanilla, menthol. I think what's really important, though, to not lose sight of, it's that, and this is the position that I think your store owners have as well, and my clients have. If the goal is to really protect the children, to make it so that they're not using tobacco products, we should be making it illegal for them to be using tobacco products. So,
Isn't it?
no.
It's not illegal for
So-
them to use it.
So, in your town, there is no use and possession law. So I talked with Needham about this, right? So now we've met with the chief of police there. We all grew up, we went to high school. You'll have kids at the football game or at a party drinking beers. If a police officer sees somebody under the age of 21, or reasonably believes somebody under the age of 21 is consuming alcohol, they can stop them, they can issue a citation, they can take away the alcohol. It's illegal. But in Ashland, if someone under the age of 21 is smoking a cigarette out in the street, the police officers, they don't stop them. They don't issue a citation. And that's sort of the funny dichotomy we have here, right? We're talking about banning the sale of legal products to those 21 and over when you have a 98% compliance rate, and we know the difference between mentholated and regular tobacco has no different health consequence, but yet we're making it still legal for those over the age of 21 to use and possess. It makes no sense. So my point is, to towns like Needham, who are now considering it, is rather than taking away revenue to the store owners, who they enjoy 97% compliance rate there, make it illegal for the kids to have it in their possession. Because the problem is, it's not that you have kids buying it, right? It's that the adults are buying it and they're giving it to the kids. Just like the adults are buying the alcohol and they're giving it to the kids.
Can I just stop, because I think this
Yes.
is important conversation. Miles, are you running? Because,
Yeah, we're aware of the issue.
okay, I'm just wanted to make you aware. Okay,
I understand.
okay. Other-
No, yeah, I mean, I got to go back to Chris's point. That's exactly what my first thing was. Nobody cares about whether or not, to me, that there's a flavor and that there's a difference between, it's all health consequences. That's what a board of health is.
Mhm.
That's what we do. You're looking out for the business owners, I get it, and we are too. We don't want to, we've had people up here who've been, unfortunately, before us multiple times and fined. And,
Yep.
So far, nobody's lost their license. It's obviously, an unintended consequence to have a kid do it. Whether or not it's actually physically legal for somebody to stop them, if the police in Ashland were going to stop every kid they saw smoking a cigarette, they'd probably spend half their time doing that. It's all a health issue, and I don't think it has anything to do with that. And we're trying to make the tobacco industry more responsible by not, at any point in time, trying to get these kids hooked. That's what all this vaping stuff is about. They're gonna start vaping because of the different flavors, or they think it's cool, and then these studies show that they're gonna move on to cigarettes when they're older, or that, that some of them will.
And I'm with
So
you on
it-
a lot of that, I am.
There's always two sides of the fence, and obviously I appreciate your, your coming here and telling us, your side of the story. But, it may not be popular, and I know John and a lot of these other members were on the board when they adopted what I believe was the most stringent regulations in the state of Massachusetts, raising the age, of smoking, and we certainly don't want to be discriminatory toward anybody, but, if you can still get cigarettes, even if it isn't your favorite kind, it's the same thing with alcohol, right? These kids get it, people who want to get it, so.
Right, they get the flavored
I-
vodka, they get the flavored,
Correct.
all
They-
those
they
things,
get-
but they can
right.
get the flavors.
Exactly. So, I definitely respect, 1 and 3, but the difference between the potential health consequences of a mentholated product versus a regular tobacco product that doesn't have any flavor in it at all is not a good argument on your part, in my mind, and at least in Chris's mind, and probably not in the rest of the board, but
Yeah.
I
I
can't
mean,
speak for them.
I think it's fair to say, and correct me if I'm wrong, I could speak for my fellow board members in this. Whatever decision is ultimately made, wherever we end up, it will not be made lightly. It will not be made without careful thought to everyone involved. And, there was another thing and I completely lost it. But that really is ultimately the thing. It's not, we
No, I
do,
recognize
we
that you guys
do,
are,
we do hear
Yes.
what you're saying, and we do understand the perspective that you're coming from. And it is something that will be factored into the decision. How it will influence it, we don't know yet. We're not at that point yet.
Can you?
I have two questions, maybe mundane questions. One is, you said the compliance is 98%. How do you measure it? One. The second one, you cited that one of the corner store has 50% business from the mentholated cigarettes. Is there evidence for it?
so.
The numbers?
Yes, so on the first point, the FDA actually has online, you can find it, each town and their compliance rates. You guys are one of the best. So I actually don't have all of my data with me. Hold on one second. So since 2013, this is from FDA, Ashland has a 98% compliance rate. So that's based on, I don't know how else to call it, sting operations. They'll send in somebody to do a test. And that's been since 2013. And now with respect to local owners, I just didn't have time. I found out about tonight's discussion on menthol on Monday, yesterday. So I can absolutely get data for you from your store owners. They'll be happy to provide it.
In 1 year, I believe last year, we had 3 of the vendors who came before us. So looking at 18, 3 of them is not 98%, definitely.
The federal government does their own comprehensive
Okay,
inspections.
so their measurement is not
So
our
it's
measurement
not
that
our
goes in.
measurement.
Our
Yes.
measure,
I know
we're
that-
stricter than the government is.
Right, that's what I meant.
Which
So
is a
we
badge
have
of
to,
honor to us.
we have to have our own numbers for compliances to,
The
within
federal
ours.
government may have done 2 in the past 10 years. 2 comprehensive inspections where we do 4 a year, 3 to
Right.
4.
Right.
Right.
So that's the
So
difference.
we probably have to put up a number of our own to find out how we are.
Yeah, we could easily do that
Yeah.
with that chart.
We've got that, yeah.
You have a chart.
Diane, you have anything?
next to you.
One, I want to thank you for coming here, and I think you're an elegant speaker. But one thing that, what I heard, and I don't want to turn this into contention, but unfortunately, you brought up the racial part, and I just want to know, are your organizations prepared to dig in on a lawsuit? Because that's kind of what I'm hearing from you. And you said it very eloquently, but I did hear that, you guys are looking for somebody to, make this. Is that a buy-in from both of your organizations?
So I can't speak officially. What I can say is that my firm has been asked to look into it.
Okay.
And what I
That's
can
a
also.
very nice answer.
What I can tell you in addition is, whatever draft regulations you're gonna have, they're facially neutral, okay? On their
Okay.
face, it's not intended. I'm not here to say that
Right.
this is an intended consequence. But there's a plethora of case law about unintended consequences for any regulations or laws that could have the cause and effect of a protected class all of a sudden being precluded on a mass scale from something that they seek or prefer. And
But you're not here to say that the protected class is the only person who consumes menthol?
correct, I'm not.
Okay.
9 out of every 10 African-American smoker prefers menthol. And
And you have that data as well?
yes, I do. And I'd be
Okay.
happy if the board would prefer, I would be more than happy to provide a follow-up letter with.
I think all
with the data.
information is good information, and the board
Excellent.
can then make their decisions based off of that. Yeah, I think
Thank
that's
you.
good.
Numbers would help.
Numbers, help.
Absolutely. I
you-
absolutely can get that for you.
You mentioned Needham. I
Yes.
take it you'll be at Needham's meeting next week?
Yes,
Oh, good.
so
Boy,
December
couple of
the
us are planning
12th,
to go.
December the
I'll definitely be there. I'll definitely.
December the 12th, there will be a large meeting in Needham.
Correct.
I was in front of the board, similar to this venue, in middle of November, and there was a lot of concern raised about the unanticipated effect, and also there was a number of business owners who came to raise their actual statistical data. And the fact that it will, it could have significant negative effects on their businesses.
And that's on the 12th.
And then the chief of police of Needham will also be there to talk about my request for the board to consider use and possession laws because 21 and under, I'm sorry, those under 21 should not be consuming tobacco, using tobacco products. Simple.
So that's next Wednesday
Yes.
at 7, right?
Yes.
Okay, good. All right, any further questions? Well, you're very well spoken, and we appreciate you taking the time. I think we learned a lot from it, and we appreciate
I
it.
really appreciate your time.
And you will probably be getting a letter from me in the next day or two stating the fact that we have made no decisions yet, and we haven't had a public hearing, but we're going to invite you to it when we do have the public hearing.
Thank you. Thank you very much.
Hey,
Appreciate it.
thank you. Nice to meet you.
Thanks.
All right, so a lot there. But, so, I mean, we're still the course of action. You're gonna send everything to Laura, then we'll work on it. And then, I will definitely commit to, if you
I
can,
haven't-
you can.
No,
If you
I'm
can, if you
going
can.
to try.
Okay, all right. And then we'll go to Needham next week if there's
Yeah,
anybody
no,
else.
and just, Chris, and just to summarize, I think from your 3 other towns, it sounds like you got one kind of saying yes, one maybe, or an in-between,
I
and
think 2 out of
and
3
one no.
Right, well, there's
Is
one definite no,
Okay,
and the other 2 are proceeding toward that direction.
okay.
Okay, good. Thank you again.
Thank you.
All right, so we'll pick that back up probably on the 18th then, because then we'll have the information from Needham, and then we'll have time to go through. Okay, good. All right, Mr. Health Agent's report.
Oh, I was just looking at our results over what we were just discussing, and the chart does not show 98%. I'm looking at the chart right now.
Oh, okay.
So the board knows to continue that, we can get that for you, but it appears it's definitely not 98%. There were further 12 operations that were complete. So with that said, it's time for the budgets.
Da-da-da-da-da-da.
What do you want to just defer that budget talk to our next item, number 5, or do you?
Let me
you
get
got an
my
update?
agenda.
You got an update?
I put my agenda or somewhere, when I was,
You can borrow mine.
and just what are we on next?
Right.
Oh, so the FY19 budget, but then, oh, okay, for the training of the Homeland Security, we were advised by the preparedness group that we belong to, Public Health Preparedness, Emergency Preparedness, that we no longer can utilize just one person trained in the Homeland Security Health Alert Network. We have to have 2 people on the call-down list. Right now, it's the chair and the vice chair and myself that are on that call-down list, with the town manager and the fire department is our dispatcher. They have indicated to all our communities in Region 4A and 4B, which is now Region 4AB, that we need one other member of the community to be on the Homeland Security Health Alert Network. It usually takes a half an hour of training. I can send you the link to it. And if one of the board members would like to be that person, just let me know, and I'll let the state know that, it'll be this person. And I can update the chart. I can send that to you.
I'll volunteer for that position if
Okay.
if the board is okay with that.
I'll send out the
I think that's
invitation
great.
to everyone. I had it ready. It's just a website link to it, and that way you all have it right now.
Is there a minimum and maximum, or is there?
No, it's just to review how you utilize it. It's more like Maven for electronic surveillance of communicable disease cases, where you get notified on serious issues. We also get notified, say, if it's unusual, but once in a while there'll be a lost person that we get alerted on that too, so. But that's very seldom. Usually it's a big winter storm on the way, possible issue of the numbers being very high for, say, EEE or something like that. So it's not like I get notified every minute. May get 1 or 2 a week, just maybe 5 a week
Did I
in their
understand-
email.
Did I understand you correctly? You said yourself, the chair and the vice chair are already on it now?
You're already on a call-down list. That's always been the case, that the vice chair, the chair are always on the call-down list, but now one of those members or someone else within the Board of Health would have to be trained in the HARN. We call it the HARN.
Thank you, Ron, for stepping up on that.
No problem.
And you should have an email, all of you should have an email related to the Homeland and Health Alert Network. If you have any issues, Ron, let me know. I'll be glad to help you out with it.
Okay, great. Just send me anything I need to know.
Yeah, I just sent the link to
Okay,
you.
great.
Should be easy for you.
Okay.
All right, anything
And
else? Okay.
now we can get to the budget.
All right, the budget. So we met, what was it, last Thursday?
Mhm.
Thursday evening in the
10 minutes
basement.
ago.
I thought it was a productive and useful meeting. And thoughts, concerns? I have a few, but I want to make sure if you guys have any.
Yeah, I thought we were supposed to get the 4 job descriptions.
I have some, our own, that when we went out
Right,
in
but there was
2014, but I've asked for for those job descriptions, haven't gotten them, but I can hand these out. This is the towns, when we went out in 2014. And I pulled a generic one too, so let me get those, if you'd like, I can hand those out.
I thought we had specific requests for Sudbury and other.
Well,
Yeah, I
we
did.
asked for
I
4.
requested.
Four,
Sudbury
yeah.
was one of
4.
those,
Yeah,
Well,
so.
haven't
I
gotten them
just-
back yet,
Yeah.
they
So
haven't returned them.
the link that we got for Sudbury was to the public health nurse website.
Yeah,
It's
her
not for the
website,
job
yeah.
description.
Correct.
So the information was, from like September, so there's not a job description there.
So these are from our,
Is there one for everybody?
yep, that should be. And this is from Andover. Should be one for everyone here. Make sure I have one for Laura. There you go, John.
Thank you.
I'll give you one of each. There's that, and there's that.
Did you want to expound on your point, KG? Or,
Give me a second. Also had additional thing about the justification for having one here, specifically describing what activities that person would do here and what we need to attend to. And there was supposed to be some trend in numbers to show that things have increased where more demand of nurses required. So that would give us a good chance to argue with the town to get that money added on. And also, there was another request was to find out whatever the savings of time that we obtain from hiring this nurse, what additional things that you would be able to do and improve our health department. That's what is to be added on. Those things didn't show up on the email.
Well, was last Thursday.
Yeah, I
so
understand.
yeah.
but-
There hasn't been much time since last Thursday,
Yeah.
basically trying to put the budget, but I had the chance to meet with, Nancy and I had the chance to meet with Kristen French, Joanne Duffy from Elderly Service, Kristen French from the Decisions at Every Turn, and Jennifer Wolfing from the Social Service Director. And we met this afternoon, so we talked about the fact of several items that they could utilize us for, as well as what we could utilize within our programs. The first thing was, it was just more or less get to know what public health nursing is, because some of the people in the audience more or less wanted to get an understanding of what Nancy did. So, and that's one of the main things that has become kind of a foresight in the public health nursing reviews, that the story has to get out there. Because as Nancy said, someday it's gonna be too late, and there won't be any structure, and when we need public health nursing, it's gonna be too late. But one of them was just TB cases, we talked about those before. Some TB cases can take up to 18 months to directly observe the medicine adherence. So we were fortunate to have not that many months, but we just had 2 in the past fall, this past fall. That takes up a good part of your day, each day of the week, except for weekends. The next one was hepatitis concerns. And the issues with hepatitis, and it was in my notes too prior, is we're seeing more drug use, illegal drug use, and with that, we're seeing more situations with dirty needles and increase in hepatitis. So that's, yeah.
So is this, are you describing what Nancy's doing now? Is this what you're?
Going over some of the situations she's handling now and trying to answer KG's, my overview with Kristen and with
But
Joanne as well
I
as.
think, just to kind of back up just a little bit, I mean, the board took a vote at last week's meeting, I understand it's quickly, not that long of a time, but the board took a vote and asked for information, and that's what you're referring to.
Yeah. that's
4
what-
job descriptions, we wanted something in writing saying what the nurses, which is, this is the job description, so this satisfies that. and then what things basically the backup information we need to move this budget forward. So to take the work that this nurse would be doing off your plate, to give us it in writing.
Oh, it won't be just off my plate. If you all remember, at the meeting 2 weeks ago, I mentioned there's a lot of things not getting done in that field as well. And if you notice the bullet that I provided to the board last Thursday, the major part of the top bullet had the major needed, volume's gone up quite a bit, the needed items that are unmet. So you can refer to that as well, but I'm just going over some additional items that were brought up today.
No, and
I'm gonna add those to the list.
And I
but
appreciate, I
didn't have the
appreciate
time.
that, but I think we all agree
Yep.
as a board that we need to add more staff. I'll say it, where I'm starting to get a little frustrated is, I wanted to hear how your meeting went with Jen last week, because it was brought to us that you were gonna talk about the budget and concerns, so I'm still concerned about the concerns. I think we're all in agreement that we need to add staff, but what I need, and maybe the rest of the board, because that's the reason why I said put it in a motion, is we need data. We all agree that we need stuff. And then what I saw you sent to Brittany yesterday, our
Yeah, that
budget
was
person,
premature.
it was
I didn't
premature.
have, I didn't
It
have the
was
minutes,
premature.
so I
Yeah.
didn't, I thought I was supposed to send all the options. So
It
I
was-
apologize.
Well, let me help you out with, I have some thoughts here that I put it together. Might help you to prepare a document that's good enough
Sure.
for justifying the positions.
We got time too, just so everyone knows. We do have time.
I
It only
do.
had to
I
be
just
submitted,
want
but it's
to,
gonna be reviewed in the next month. or
right,
so.
right. Let's, for example, the food
Excuse me,
inspections.
The Board of Selectmen gets the first draft at the beginning of January, so we
Oh,
need,
we got a few more weeks at least.
no, I know, but we only have one more
Well,
meeting, so that's
right,
what I
we
think
only have
we're
one more meeting.
trying
Sure,
to
no,
gather
that's
the
fine.
information,
That's
so.
fine.
Two things, we cannot rush and then make a hodgepodge. We need to really
Yeah,
pay careful
let's
attention
only
to
send
it.
it once.
Because
and make sure
it's tax
buttoned
money
up.
that we are giving, so that's what we need to make sure. One, regarding the food inspection, I know there is numbers available from the Ashland Day event, the temporary food inspections,
Oh, yes.
and the farmers market, that also has come up very recently. We never had 10 years ago the farmers market, or 5 years ago. we
Or the
never had.
corner spot.
The dragonfly, the corner spot. These are the numbers that you have, which you can put it in, and then put it in a timeline, saying 2010, 2012, or whatever that numbers are, you can put it in. You can easily justify the additional need for that. Or if you don't do the inspection, then the quality of food may not be good. So we are risking, so that's what you need to put it in. And coming to the nurses' help, there is no registry as of now for the opioid or the dementia. We don't have a registered documentation saying that this many people are affected by this or something. We have no collection of data, but it's scattered around. If you can put that together and say, this is where our nurse could help with this additional information.
I don't know on dementia, but I know we have information on opioids.
Dementia, we don't have it because they're trying to prepare one with
Oh, okay.
with the help of the police chief.
Okay.
And opioids and Narcan, I know that we had some scanty numbers from one of the officers who was here that they were presented.
Yes.
Yeah, he gave us, but we don't have much. So if you can put those numbers in there without the names of the people and repeated items, repeated clients, or how many
But
times
that's
they use
to
Narcan.
us, though, correct? I just wanna make
Correct, but
sure-
if you
right.
put those
I'm
numbers.
with you, I just wanna make sure that it's not sent
If we
to
don't use
management.
Narcan at all here and it's sitting there, then we
Yeah.
don't need
Right.
the service provided for, right? So that's what will happen, so we need to make sure those numbers are shown up.
But
Yeah.
only to us,
And then-
not that we're hiding it, but it's
Yeah,
like
well,
for
yeah, I
our
understand.
discussion,
We-
for our
we-
discussion.
We qualitatively recognize there is problem, there is need for it, but if, for somebody to spend the money, we need to justify the number. And you said
Looking for
they're hiring
$65,000.
ClearPath for hoarding. So find out how much is the expense that we're doing it with the ClearPath for hoarding, and see if that can be utilized by hiring our nurse here, who
But
can
that's
do
the
the
stuff
job.
we're saying is would be because that's one thing, Mark, you had said that the hoarding, it was time consuming, that would be one thing you wanted from this person, but we were saying that's really not,
Right, but all of these things that he needs to put it in somewhere or the other, saying that if we're spending the money for ClearPath, if that work could be done by our nurse, we could get that money over here and put it in the justification. So that's what, and the communicable disease also, I didn't see any data for it, so that's another thing that you can get information on, and then you also talked about hoarding case all done. Well, that's all I have. So if these numbers, you can put it in over the past 5 years, that will give you a strong case for us to argue for. That's what I think.
If, going back to some of the things I brought up on Thursday, and partly to Diane's point too, I think when we talk about a job description, you need to go back to your goals
Yep.
and look at how we can align the description of the job we're asking for aligns to your goals. It's necessary, it's essential. If
And
it
I
do-
was
if it
going
doesn't,
to,
I'm telling you
yeah.
right now, you're gonna get shut down.
Yeah, well, I have
There's no doubt about
now
it.
at least 10 more from this
Yeah.
afternoon.
And I know,
So that's
and I
why
know,
I'm trying
I
to
completely respect it. This
bring
was
them
just a
all
few
in
days
and
ago that
then-
we met.
Yeah.
But this is something, if you want
No, I
this,
just
if
wrote
you
it
want
down.
this position, if
Yeah, and I'll
these
add
goals that you're
to that.
presenting to
Yeah.
them
That
are
is-
not reflected in this position,
Then we're just wasting our time.
Right.
it's just
Yeah.
not gonna happen.
Wasting
No,
our
that's
time.
fine.
Goals,
not gonna
goals
happen.
out of this position will not help you. Only for this position, whatever the goals are, that needs to be put on the
Right.
document.
Sure.
And-
I know that the
They
Board
know
of
what
Health
the-
has various factors, which all of it cannot be accommodated by the nurse, but only a certain part of it is.
Right.
So that's what we need to put it
Yeah.
together.
That's fine.
This, I mean, I have to just lay it out because it's been bothering me. I know I talked to Mark directly about it, but this that was sent to Brittany was not accurate with what we talked about Thursday night.
And I agree, and I didn't have the minutes till this afternoon. I started listening to them this morning, but I was thankful to have Laura get me those minutes, and that was just from Thursday. And I saw them, and you'll see, I'll reflect the changes, I already have that ready for discussion. And you have a new worksheet, and
But
then
you-
what I'd like to do, if I can just finish, is to discuss that. I have it right here, and see, I circled each one. I know the first one that I can put an X in is a health agent assistant. Indeed, you guys discussed it and said, let's go with the health nurse, and you said, let's put $60,000 was the bucket. So, where I was confused was the 2,300 for overtime and the 2,000 to the 60. I didn't know if that was the case, or was there a case for the vaccine to be
No, we got rid of
purchased?
that as well.
But there was no vote to vote it down, but that was the
No, because
consensus?
what we did is this Thursday night, we discussed this, said we
Okay,
were
then
going to
I'll
go,
X that
we were
out.
going, the three things we were going for was the full-time public health nurse, the overtime for the administrative assistant, and the on-call coverage.
That's fine.
The reason why we didn't vote on it, because we all wanted to feel comfortable.
Right.
That's why we wanted the job descriptions, all this information tonight, I'm assuming, so we could vote on it.
Well-
But I can't vote on it, and I can tell you that this discussion, for me, there's not much for me to discuss. I thought Thursday night we had it was a great meeting, it was a healthy conversation, but I can't move forward on this. I can't move forward on it
If I
tonight.
can
We're gonna
just
have to
add
meet it on
though,
the
and
18th.
I would not want you to move forward until we, till the board makes the decision. But in talking with Nancy today, which I didn't have the advantage of her till today, she said if you don't buy vaccines, then if you do decide on a full-time health nurse, she goes, shingles you have to pay for, flu vaccine you have to pay for, pneumonia vaccine you have to pay for, and tetanus. She did say that there are free vaccines for children, but the others have to be paid for. So if we go with a full-time nurse, unfortunately, some of the goals for vaccination clinics will not be met if we can't buy the vaccine.
Right, Mark.
So
Yeah, but
understand they
can we
go
just-
together.
Can we just take a time out here?
Yeah.
Because I'll do it, because I always play the role
Yeah.
real well. Mark, I gotta say it, and I'm not saying it about you, but I'm calling BS here. Because my 25 years of experience of working inside these four walls, telling me that there's something that doesn't add up here. I asked once, and I'm gonna ask one more time. I wanna hear about how your meeting went with Jed.
Okay.
Then I want you to explain to me why we sent stuff to Brittany that we didn't agree on. And three, I still want to leave this table tonight knowing that we're all on the same page, because that's what we're doing here. And like I said, my years of experience in here says there's something more going on than I think this board understands. Now, listen, I have the utmost respect for our town manager, but if they're giving you pressure and you're not telling us about it, we need to know about it. And I'm not saying that they are, but something's not adding up here. Like, you came to our meeting last Thursday and said that there were concerns about us talking about this. I think this board needs to know what those concerns are, because maybe that'll help us add up to what's going on here.
Sure.
And that's about as calmly as I can say it. Like, so how was your
you want
meeting
me to
with
go in
Jen?
order?
Well, how was your
1, 2,
meeting with
3?
Jen?
The meeting with Jen went well. We met Friday afternoon around, I think it was around 12:30. And I didn't know what the meeting was going to be about either, you know, and I explained that to her. I said, I didn't know what I was walking into. It was a good meeting. And it wasn't about the budget.
Okay.
It was more or less about the meeting we had, but we brought up one of the town's persons, and she just wanted to make sure it was clear. She said, you know that person? I said, oh, of course I know that person.
So
it
your meeting was
that
about our
person.
meeting that we had the night prior?
The one on the 20th of November.
That Tuesday, okay.
Yeah, because that was televised.
Okay.
So it wasn't about the budget, so that takes care of one.
Was it about our landscaping issue?
No, it was about the person that was
I
brought
think
up, that was the unknown.
yeah.
If I can bring her name up, she's
Well-
coming to our meeting on January.
Well, I was gonna say, I
in
just wanna,
January.
I just wanna back up.
Yeah.
I personally, at the Thursday night's meeting, said absolutely it is improper and unprofessional for us to have these people in front of us and tell us what they do for work. We need that was another thing we decided Thursday night. We wanna see their job description to see if we can integrate them into this position. But if they wanna come and just say, hi, how are you, this is what I have going on, but I just don't want it to be like an interview. I think it's gonna be a very uncomfortable situation for all of us.
Yeah, I would not suggest an interview. I'd suggest
No, I know, but we
more
said at the last meeting that
what-
we weren't gonna do that.
what the interview, correct?
Have them in front of us. We wanted to
Oh,
look at their
okay,
job
'cause they're
description.
they're willing to
You
come
were
in
gonna
and
get
say,
their job description from Lisa
they're willing to, we're talking about Kristen French,
and,
correct?
and Jennifer Wolfen.
And we
You
met.
were gonna get their
and
descriptions
we
from
met
Lisa,
today.
the HR director.
I haven't had a chance to get those.
I know, but that's what I'm saying, is that we
Again,
don't
I
want
didn't
them
know
at
I
the
was
meeting
supposed to
yet.
get those. I knew I had to get job descriptions for the nurse. I'll get those as well. But they're willing to come in, but I can tell them, don't bother. You know, it's up to the board.
think
I
until
thought you
we're in
wanted
a
to
better
meet them, meet
position,
and greet.
I think until we're in a better position, I don't think we should have
me
them
get
here.
their
to-
job
We don't know
descriptions.
what this person's gonna do yet.
The
The full-time person that we're looking
Position
to
that we're
hire.
trying to create.
Because we
yeah,
wanna
yeah.
we wanna try to, work with them, but
But I
Well-
think, Liz, I think it doesn't have to be a long thing, but, everybody's specific job description, a lot of times, everything that they do or that's in that description isn't necessarily done, and they do other things as well. So to kind of get it firsthand from the people that are actually doing that job, this, I guess, precludes, or make sure that we have the time to do all that. You have to really see how exactly what they do matches up with what we need and what the job description is, so that we can see where we're falling short.
Right.
And I think to your point, and your point, as well as everybody's point, if there is a significant amount of overlap, then I guess we can't justify at least
Right.
that full-time position, so
Right.
that's,
I think John knows firsthand that when, he, brought up the opioid, and he was like, well, somebody's already doing that, he was like, oh, and I don't wanna be that person that it happens to again. And
Right.
they say, oh, we have somebody who's doing that already.
Well,
Right.
it brings back, if I can, our discussion today, which really, what was more than helpful was Joanne Duffy being part of this meeting. And exactly what you said, Ron, there's things that are not getting done that Joanne would even like to see with the elderly community. And I have a list of them that I'll add to the job description.
That's
And
good.
also Audrey LaCroix, our head
Mhm.
nurse at the schools, she also sees a major need of things not being done, including mostly children's school entry vaccinations.
but
So-
that's where I think having them here, not just a job description, but a person saying, all right, well, this is what it says I can do, this is what I actually can do, this is what's not being done, and what should be done based upon, what
Yes,
Mark
yeah.
knows needs to be done, plus what those people see as falling short.
I think that,
With respect to the school, it's better that you buy in with the school committee, because we don't want to trespass on their
No,
jurisdiction, even though if it's
the
a
schools
nurse
don't
there,
vaccinate.
they may
though.
have some issues or privacy issues or whatever it is between the
No,
departments.
Oh, I
But if
agree
we're-
with that,
if-
yes.
When it's
But
involved
it's
with
the same
children.
thing, if we feel that that's part of this person's job and that we're going to move forward on it, we could get a buy-in from them on the
Right.
concept.
Mhm.
Not
Right.
necessarily for their money, but just to let them know
Their
that we
services.
are moving forward with this, and we'd like your support because it would help the school as well, if
Correct.
that's what we decide to do.
Correct.
Same thing with the communities, the council on aging.
Right.
If they have services that aren't being met, and we feel that that person could help with their services, that's fine, but we need That's the stuff we
No,
need, is
these-
what is this,
These parts are all within the town administration, the Council of Aging and everything, but the school is
Right.
in a different administration, that they're two different, so we need to be
No, but
careful in doing it. But if we are helpful to them, I'm sure they would take the help if it's reasonable for them.
I guess, and I say this with extreme caution and the utmost respect, if we've got 80 hours of social work and opioid prevention going on in this town, and this board doesn't know about it, something's wrong here, folks. I mean, something's drastically wrong.
well, maybe,
Like-
I mean, with,
Like,
maybe.
am
we-
I wrong?
Well,
Like,
Well, Mark had,
Yeah, I mean, Mark, when did the split take place that, where part of, I think, what I would call, should be under your direction, not necessarily be under your direction anymore, right? What?
maybe you should
I
just
mean,
give
I
us an
think-
update
I
on
think
what
that's
they
big.
explained to
3 years
you.
ago, you reorganized it?
I'll get to yours, but I
Yeah.
didn't hear yours, but I'll ask again. But around 2 years ago, we were involved with human services and going to meetings, and it just evolved more to the departments at the community center. And I explained that that would be good for us to get more involved. And actually, today, in our discussion, it was a good meeting. The discussion took place that Nancy's main office should be at the community center, working with the human service people, and report up here now and then. We don't even have a confidential office, but that's kind of where the direction was going today, to realize, and they said they could, the problem is Nancy getting the word out, or the position, the word getting out on the position by all that work in human services, that we have a public health nurse willing to do medicine adherence, blood pressures, osteoporosis overviews, different clinics even, and a lot of that does happen at the community center. So
But
that was the
can I
main.
just
Both of
ask for
those
clarity?
hires were after that time, so you
Right.
might, not that you didn't know, but it wouldn't have necessarily been communicated to us.
But the position you were talking about today, just for clarity purposes,
The public
what,
health nurse,
was 5-hour public health nurse or 40-hour public?
40 hours. Yeah, they know, they realize, because it comes up in other discussions such as the opioid
Well, see,
task force, they know she's only 5 hours, so.
But I appreciate the conversation, because I think it's a good conversation, but we're already figuring out where somebody's office is when we don't even know what the position
No,
is yet. I think
yeah,
we
I
gotta,
understand.
Yeah.
it
Well,
feels
and
like the dog is wagging the tail here a
Well,
little
and I
bit.
agree, I wrote it down too, because we don't have a confidential area, we just had to build offices for the 2 new people. Where are we gonna put another nurse up there?
But
Right, right.
historically, public health nursing is not new. That's a weird
Well,
statement.
I'm not
think,
But
saying
it's
it's
not,
new, it's just-
it's, we're not recreating something that hasn't been here before by many a volunteer, including Mary Mortensen, by many of Framingham nurses, including Kitty Mahoney. It's not new, we're not creating a new position here.
no,
We can call Sudbury, and I spoke to their agent on Friday, to get how they got to this point. I talked to Southborough's nurse on Friday.
But this is a new position for us.
It's a new position, but not a newly created idea.
No, but it's it's a $65,000, it's a $60,000.
It's a position that's increasing, it's not a new position here.
Correct, but it's a
We've always had-
$60,000 budget item that we need to sell.
I recognize the money, but it's a
Okay.
needed position in my view, and that's what I'm trying to tell the board.
I think we all
We
agree.
already
all-
agreed that on
We all
Thursday.
agree
So,
that, we agree
as it
on that.
relates to building a position, as I said, I can go to other towns, they already have these positions well, they're working with others within their own communities as well, and there's so many, and we had a grant, I don't know if I mentioned this at one meeting, for public health nursing promotions, promotional public health nursing. That includes such things as your clinics, dementia clinics, osteoporosis, screenings.
Do we have
going-
anything that would offset the $60,000?
We don't have that grant anymore. That
Well,
grant.
could we?
Could we? No, in fact, Metro West Health Foundation was concerned when we had that grant, which was only 3 years ago, that seed money never went anywhere afterwards. And it's unfortunate. So you can see this need has been around, and I give this board credit. We got 5 hours. That was pretty good, actually, 3 years ago, when we got the 5 hours, but we really, if we want to run appropriately, and I can get you all the numbers, and all the other towns surrounding us, and there's other towns doing the same thing as we're speaking, Millis, Hopkinton. I don't know where Holliston's going, but they're having the same problems. We can, and if this doesn't work, we can consider regionalization. There's a lot of different options. But I can
This will
get to the
work.
board pretty much the mold that's been built around public health nursing for hundreds of years. We're not recreating a
I
new,
think we
we're
all
not
agree
creating
on the
anything.
concept. We just need to get ahead of the
We know
game.
we need it, but we need to sell it to somebody, the idea.
That's what I'm trying to do right
We need to
now.
give the
I
justification.
want you to
because
too.
It's the tax money, it's not somebody's grant coming up here and then
I don't
putting
want
it
to
in.
fund this with a grant. I don't
It won't
believe in
happen.
funding
Right.
positions.
I understand,
with
but-
grants. I mean,
You
that's-
can't
They
fund
won't
the
re-
required
It's not, we
position
need,
for the
we
grant.
need, we need to
No.
justify it to them, it's a tax money
No,
that we're trying to spend, so we need to
If
give
anything,
somebody.
the other two positions that we discussed, and if I may,
Please.
we've talked a little bit about those two positions, and I'm just gonna refer to them as positions, because I don't wanna attach personalities to it. The people involved
Right.
aren't relevant to the discussion at the moment. I think that there's I very much agree with John on the bigger piece of why is the Board of Health not involved in their work, and why do we not know about it? But it's not, I don't think it's relevant to this specific discussion. So let's
Yeah, they're two
table
different-
that for
yeah.
now.
Yeah, they're two different.
The other thing is to have individuals come in here and tell us what it is they're doing. That puts us in a position of judgment, potentially, and that's not our role. What I do think will be helpful is, because it's public record, is what their job descriptions are. What is their posted description that they're being paid on? What is their expectation of their roles? Because if we ask for something that is in that description, that's gonna be the feedback that they're saying, well, we have someone that does that already. Whether or not it's getting accomplished,
see what you're saying.
completely
I see-
irrelevant.
I see what you're saying.
I agree.
But if they're
100%.
paying someone who on paper is supposed to do this, and we're asking for someone to do the same thing, we're gonna get shot down.
Just so you know, the positions are the Director of Decisions at Every Turn. That's a school program, and we would involve ourselves with it, but we're not gonna be running decisions at every turn.
Nope.
I have two people that
Nor
run
do
that
we want to.
program, the person you're talking about and their assistant.
Right.
The other program is a social worker, and towns have social workers. We
Right.
had the social
Yeah.
worker here full-time for years. She worked with us downstairs with us, as Diane remembers, the cellar dwellers. And so that's not new either. So
Yep.
these aren't new positions, but I will get their job
It's
descriptions just to
perfectly
make
okay.
sure.
It's to your benefit,
'Cause
because
they
you just
gave
wanna
us
make sure your
today.
job descriptions for your nurse that you're asking
Yeah.
$60,000 for isn't
Not my
doing the
nurse,
same.
your nurse.
No, I understand that. You just wanna make sure
I
that-
understand
that
where you're
there-
coming
there's
from.
no overlap in their
I
job
res- I
descriptions.
respect
'cause
where you're
they'll-
coming
They'll shoot you down for that.
Yeah.
But Kirsten, and like, once again, I don't feel comfortable talking about the names, but the position, so you're saying her direct report is to the school committee? Not to the
She is the
town manager?
director of decisions at every turn.
I
but
understand that.
I would have to get her job description. I'm not for sure
Oh, we're
if
back.
that committee falls under town management or the school committee. I believe it's town management.
Okay, okay.
So if we can just get back to the basics for
Yeah.
a minute. So our budget was, our draft budget was due. Sorry, our
Friday.
draft budget was due Monday.
All right, Monday.
So
Did
I
we
just wanna
submit
make-
that?
I submitted it too fast. I wish I had the minutes. I would have submitted what you have in front of you here. And I would have modified this. This being, I'm pointing to the descriptions of what's in the budget here.
And we did
Everyone has a-
reiterate it before, at the end of the meeting.
I didn't have the minutes, and I probably was writing numbers down.
But we
I was-
didn't, you,
But I didn't, I thought you wanted me to, honestly, number two, John, you had asked me, why did that get submitted yesterday? I thought that's what I was supposed to do, so my apologies to the board. I thought we were, and that's why I took a picture, and I know someone else took a picture of that.
I did.
The bulletin board, because I thought that's what we were going with.
we agreed.
So I apologize.
We agreed on what you
Probably-
asked for as a public
Yep.
health nurse.
Yep.
So if
Probably
I,
thought we were supposed to go with the options to see what would happen, but again, now you have just FY
well, we need to
'20.
make sure that this is revised appropriately.
Well, look, you can look at it, and it has been.
And I'm talking about this sheet right here.
Yeah, and again, just, can I ask the board again, no vaccines, even though we're
No.
going to try for a full-time nurse?
No vaccines, no
Well,
assistant.
it's, why, can I ask why you don't want vaccines purchased? It's not gonna help the program out. That's the whole reason for the full-time public health nurse, is to increase vaccination clinics.
How many vaccines are you talking about?
Well, we're trying to increase the flu clinic. Joanne, when we had
Right,
this
but how
discussion today.
many vaccines you
We
would
used to
get?
get 300, we're hoping to
So
get.
that would
if-
serve how many people?
If we, well, just the other thing too, on all these vaccines that we purchase, reimbursement. Takes time, but we can get all
Right,
that money
but-
reimbursed. But I'm hoping to see, and this is very general at this point, KG, but as Nancy said today, if we start in August and we start getting down to the community center, once it's a full-time position, people are gonna get to know your public health nurse, And as Joanne or someone said in a meeting, people do not like going to doctors.
And we might not,
So-
if we come up with a job description, I mean, we may or may not get the $65,000 position.
Correct.
But if we have 5 hours now, let's just go for the full-time, and if we get 20, we'll be happy. We'll take the job description and we'll have to narrow it down, because we can't have a part-time person doing full-time work. Vaccination clinics may not be in that person's job description. Chris spoke about it very eloquently at Thursday night's meeting, that the way of the world right now is not to come to a public clinic at the local Board of Health. It's just not what people do. So that person, we might have 10 other things that are more of a priority to help your workload than her doing a vaccination
But
clinic.
if I can.
But
that-
just to,
oh, sorry.
That's-
I'll give you, of course. But we agreed last Thursday is that the bigger fish to catch is to get the position. And then when we have the position, to have a year's worth of data to say, you know what, we really screwed up last year. We should have bought those immunizations. Because we agreed also with the resources of this board, no resident of Ashland will go unvaccinated. Via confidentiality, this board would get those people vaccinated. But then if we have a year's worth of data to say, you know what, we really could have used that, I think that's more powerful, because it's coming from that public health nurse. Because nobody on this board is gonna allow somebody to go unvaccinated if they want to be vaccinated. We have the resources on this board and with you and the contacts in the community, that we would get it done. If we had to go to the governor and say, hey, we need emergency vaccination, we would get that done. We would definitely get that
I
done.
put my push in.
No, but I agree with Mark, because I was at that MRC, I just happened to volunteer at that, and there were over 1,000 doses in 4 hours.
Right.
And there were all walks of life in there, people that had no insurance, which was very minimal, and, most people that did, and people, came as a family, so they didn't have to, get in the car and go to their doctor and potentially pay co-pays and take time out of their day. It was on a Saturday, and it was utilized there were families coming in, mom, dad, 2 kids that they just picked up from soccer from affluent areas. And, I know from the data that you got, there was at least a certain number of Ashland residents that
200,
also.
according to Kitty.
Right, so that's
200
a
people.
significant number, that would
How
directly.
many were uninsured?
I can't tell you
Okay.
that.
But the point
I
about
think-
that
I
is,
think-
even if we did a clinic, and
Right.
we are accepting people's insurance, we don't need seed money for flu or vaccine.
No, well, I would say 80 to 85% of people that I personally
Right.
saw. I was one of 10 people checking people in.
Right.
But
I
see,
would say
and
they
I agree
had.
1,000% with you, Ron, but
let-
we could get $3,500 like
Let-
that.
let-
I don't think we can get
let-
65,000.
No,
me-
I
And that's-
agree,
that's
but
what I'm
is it wrong to not, say, why not ask for the extra 3,500 if that's
Okay.
what
That's fair.
Mark thinks we potentially need to cover that for the year? Because there
still
are
have
gonna
a
be some
credit. You
people
guys
that I
said we
think
have a
will.
credit.
Credit, but that's only with the Merck company. Shingrix is what hurt us when we tried getting more applicants to come, more recipients to come in. One thing that was mentioned, today's meeting was it was a good meeting, as I said. Many doctors, and this was brought up at the meeting, do not have the vaccines. They refer people off to clinics or refer them off to your local pharmacies. That's the only 2 places. Doctors, it's so costly that doctors aren't carrying vaccine. The other thing we talked about, I'm almost done, is the reluctancy of many people, according to Joanne and their community, are reluctant to go to their doctors.
Did both of those statements come from Joanne? Because I find those both very incorrect.
Let
Well-
me,
Because I think we spoke about that Thursday. You don't even see a doctor, you have an administrator, you.
Look, the
let-
reality
They
is,
Different generations.
let me give you my example. I had my vaccine done with my physician at the Tufts.
Yep.
But he said for Shingrix, you have to go to one of these clinics.
Right, because they can't
outside.
yeah, I had
staff
They
it
don't
right.
get it,
Yeah.
yeah. But CVS didn't have it anyway, so I couldn't get it.
but, yeah.
We have had vaccines in the past few years. I know once I also got it from the state with your help, and then we had it at the
Oh,
temple.
yes.
Subsequent to that, we have had it in public here in the past 2 years. How many of those have been utilized every year? That's what that gives you, and
And-
how did we promote it? We promoted to a limited number.
Good point.
Even with the limited number, how many of them that we took it?
And that was the biggest problem, promotion. When you got 5 hours to do the work, it's hard to promote your clinics. Now, if I can, just on one more
No, go ahead,
point to
yeah.
that, is that in this discussion today of the whole group, they felt, once the public health nurse was in that community center, vaccination clinics both there and in the homes of some of the people that are part of these programs would be very beneficial. So that's why I'm explaining it. You can vote the way you wish, but that's why I'm explaining the importance of it.
And my argument to that, Mark, would be, is it worth the investment of time to promote such a thing? When literally within 5 miles of where we're sitting right now, there's a half a dozen pharmacies that people can walk into and get the same
And I
vaccination.
would have to say yes, because they're reluctant to go there.
Even to a pharmacy.
Yeah,
The-
I would have to say
That's
yes.
where the question of statistics comes in.
I have a
You
hard
get
time-
from
I have a hard
registry
time believing
of,
that.
of the 17,000
Yeah,
population, how many are not vaccinated?
Well, especially
we
the
know?
ones, if I can just, because I don't want to have two conversations, it's not enough for poor Laura to write the minutes.
Yeah.
But, and the one reason was brought up, they don't want to even leave their homes. So these would be home visits for many of these vaccinations.
Okay.
Okay.
And there are
Just so you know.
services that go to people's homes for that.
Sorry, KG.
There
It's
are
a small
services,
number.
there are services that provide it.
And seeing that's a
So,
small number,
just-
then, yeah.
I mean, like I said, I have not been sitting at this table doing this, but, you know, even, let's just, we already know that we're gonna go for that position. We need data to move forward, and then we'll see what happens. But even the two other items here on the agenda, we might have to compromise. We might not get everything.
Sure.
We might have to go back to paying Laura, having Laura take time off instead of comp time, because we feel that the nurse is very important. We might not be able to have, I believe, I'm making an assumption, maybe 6 weeks off of vacation a year. Mark's been here a long time. We're looking at $2,000 for 6 weeks of vacation.
Well,
We
in all
we may or may
respects,
not get that money.
we've only used it when that long time period was off, and it wasn't vacation time, I can promise you that.
No, but that's what that would be for, is for vacation.
No, it would be, but again, we could lower that possibly, because now that hopefully I
My
won't
point
have
is we might not
any
get
more
that.
long-term vacations. I'll call it a long-term vacation. Hopefully that won't happen, but it could, but
So, no.
But
This-
again, the thing I would say is that, remember one thing, and it's an unfortunate thing, John won't be here, and John did a lot of the on-call coverage for me when he was here, and thank you, John. Again, I thought the same thing out. I
So
said,
with
we
the
could lower
$2,000
that. Then I
for
said, well,
this
John
coverage,
did a
what is
lot of
this
the
for?
on-call. It would be to pay the engineer when, see, in septic system worlds, there's a demand to get into a house and an interest rate's going up within 2 days of the month changing over. There's a lot of pressure in that world. So if I'm on vacation in the summer, say in July, and they need a closing done and they need the septic inspected, the septic inspector would come in. You have a fire at Chestnut Apartments, you have a need for sheltering.
So
You
it's
have
for
another
emergencies only?
emergencies. It's not like they'll be sitting in here while I'm
So it's for
on
emergencies
vacation.
only?
Emergency coverage, yeah. And it could be
again,
lowered.
just because we
but
talked
you-
about this the other night, like, do we know the $2,000 breaks down to
It was an
fif-
average. We
50
wrote,
bucks an hour, and we estimated each call
well, we
is
have
2
their
hours?
hourly, the hourly's right here.
But is it estimated, like, usually each emergency call is 2 hours?
We were figuring on generally what happened last year with the storms
Okay. I
and
just
so
wanna make
forth,
sure
the
I have-
fire, the time Steve had to spend, but I wouldn't have a problem if the board wants to bring that down, you
No, what
know?
I'm saying is, if we had to.
If it goes over, then
if-
we bring it
If
back
they say
up.
you can't have it all, we need to cut a
What's
little
our
bit of
average
money.
over the last 3 years?
Well, we never had
You
it
know,
to this.
it's not a good
It
number.
happened due to an
Never had-
emergency.
Okay,
We
I'm
never
very
had it.
expensive, I just don't get paid.
I got you.
Yeah, I was just gonna say,
No, but
thank
we
you,
might
John.
decide that the
So-
public
I
health
thanked you
nurse
twice.
is
I
more
don't mean
important
that.
than the
No,
$2,000.
And I do want to, because I need this to go on the public record, and I agree with you, Diana, from, one of the things you mentioned is something that I've faced myself in terms of overtime. I'm in a position right now where it's very hard for them to ask me to work overtime. They can force mandatory overtime on me, but in my contract, I can't get paid for it. I can only get time. And I will do everything in my power to defend paying Laura.
Oh, absolutely.
No, it's not, and it's partly because I think Laura's fantastic at what she does, and I appreciate you very, very much. But just from a moral perspective of someone who is coming here after work to do their job again, should be paid for it. Everyone should be paid for what they do. If we're asking someone to earn a living, to work, they should be paid for it.
Just for clarification, she was compensated
Yeah.
for it.
Yeah.
Just changed,
Right.
what, this month?
And
So all the years
Yeah.
she's been here, it
Mhm.
has not been,
Yeah.
it's been
Comp time.
comp
Yeah.
time. So she's getting,
Yeah.
I mean,
For me, comp time isn't really the same thing.
Right.
It just doesn't, because we work way
It never
too
works
hard in
out.
our regular jobs
Never
to get
works
that
out.
time. It just never, it's never, I know
It's
in the
not
business
even.
world it is, it's not the same thing.
no, it's, you actually get
Yeah.
better time off when you get paid, because you get
Mhm.
the equal time
Yeah.
off versus
Yeah.
getting
So,
Uncle Sam
so
taking his cut.
if
So-
that's a fight, I would hope that the rest of the board would back us up to
Mhm.
fight for that it would be, it's a small amount of money. It's not a huge amount of money.
But my
but-
point about that
yeah.
is it's the same thing. We're going for the
No.
23, the
And
2,
you're right.
and the 65. We
Right.
may need to compromise.
No, you're right.
Right. So
You're
we need to be
absolutely right. I
careful with-
agree with you 100%.
Okay.
If there's compromise over the overtime versus the on-call, I would say chip away at the on-call
Yeah.
versus the overtime.
And that's
Because I
probably
know
closer
the
to
board
where I was going
members
with
Yeah,
that.
no,
won't
I
mind
think we
helping
all
out.
agree with, yeah, I
Yeah.
think we all agree with that, but just saying is,
All right, I wish we had our whiteboard here, because I would use, I would
No
use it,
more.
I would,
I
I would
made a
use, I would
mistake
use it
from the
right now,
whiteboard.
because, one, the most important thing that we
marker
have to
agenda.
walk away from tonight, we have to, and we have to do this, is one, we are a solid team, and we're all 100% buy-in. And if
Yeah.
we're not 100% buy-in, get comfortable, because we're gonna have to get 100% buy-in.
Yeah.
Secondly, I want to make sure that we properly report to whoever you have to report to. Is it, if it's Michael, Jen, or Brittany, that this is what the agreed upon number, because we can't walk away not being on the same page, because we weren't on the same page before this meeting. I think it's important that we take 5 minutes and go, all right, we're all in agreement on the public health nurse. We're out, okay, write this down.
Well, in fact, can we go over this chart right here?
Well, that's what I want to do. We're all in agreement on the public health
So,
nurse, right?
I'll put check marks, so that's the right side where it says
Okay.
FY '20, not centered over it, I apologize on that.
Well,
can I make a suggestion? I mean, I
please.
might even go to the extent of a vote, because we went over
Yep.
this, ver-
I
2.5
wanna
hours
make a
was
vote.
the other.
I want to
other
make a
night.
vote, yep.
My thing is we do not physically need to all go over this. We went over it Thursday night, very
Okay.
extensively. We know what we want, right? We know what we need Mark to do,
Right?
and we'll take a vote on it. Because it wasn't clear Thursday night, and this got sent down to the finance director. Okay?
Well, just, I think I'm in agreement with you, but it was clear on Thursday night, I thought. Was it?
Correct, but
Right,
a
okay.
mistake happened.
Okay, right, okay, that happens, but
So,
when you said it wasn't clear, it was clear,
well, Mark said it wasn't clear to him.
okay.
I was probably writing at the end of the meeting, and I really thought
We recapped
my
it too. You
charge was
asked
to.
about it and recapped
Yeah,
it. So
and
it
then
was.
once I saw the minutes, sure enough, it was,
Okay.
not
So,
the correct
I want to make
process.
a motion that Mark Orm revise his FY 2020 budget to submit to the finance director to include an increase in the overtime for the administrative secretary for $2,300, a full-time public health nurse in the amount of $65,000, and an increase in the budget of $2,000 for on-call,
I apologize. Did you say an increase to 265 or
Two-
from?
265,
Okay, thank you.
265,000, because I
thank
think
you.
it's 5,000.
Yeah, I just wanted to make
You're
sure. I heard
correct,
it
so-
Right.
Yep,
Yeah.
265.
265,000.
So adding 60,000,
Mhm.
right.
And the $2,000 for the on-call coverage, for on-call emergency coverage,
How much was that, Dan?
$2,000.
2,000.
And would like to also add, could you, I mean, you or somebody review just the context of this before it goes as well? Would you like to do that?
I think that's
And
important.
have John
And
review,
I'm gonna add to it, just so you know, from our discussion.
review
and
the goals and the backup information before it's submitted to the finance director.
Yeah, okay. Well, can I add one caveat to that? And then, when and if there are questions and concerns, that a member of this board sit in on that conversation
About the budget.
about the budget. Just in, not because you can't handle it, but just because, in case somebody misses it.
So if I may ask.
So like if Brittany or Jen have a
We don't
question,
need to
can we get somebody on the
factor this
phone?
in, right? Because that's coming
Let's
out
have a
of the
conversation.
revolving
So-
account, right?
With all that said, I think I would also ask the board to consider to amend the motion just to include the budget as presented for FY '20 in the flow chart, because it's exactly what you just voted on the descriptions for the change in programs. Everything there is changed, the food inspector per your last meeting to bring it up to 20 hours a week.
this
No,
would,
no,
if this,
it's-
No, we didn't,
20
no.
hours, 20
Oh, you
hours
did?
additional.
Okay.
It's
20
not 20
additional,
hours. Bring it
20
to 20.
additional hours.
to what
20
he's doing,
hours
so that's
additional.
30.
37. No, it's
What,
37.
additional 20 hours.
What's
Yeah.
Tom doing today, this week?
He's doing around, what do we average,
10 hours?
15 or so?
So we're saying increase it
Whatever
to
it is.
35.
Yeah,
Okay, that's why. I
his
wanted
time
to
plus
clear
20
that.
hours, that's what we said.
Correct.
So if you look, it says food inspector, presently he's working 20 hours in 2-week payrolls. So every 2 weeks, he works about 10, but he's brought that up to 15.
Okay.
And then what I did is I added the additional hours to that. So it came
as
out,
long as this
It-
column
it'll
here,
be
Mark,
20
reflects what
hours.
we just,
Yeah.
what we're voting on.
so you want him up, to that position up to 30 hours per week?
Right.
30 hours, okay, just so I'm clear on it, so.
So for the balance, if we need to
No.
hire somebody, we need
No.
to hire somebody for the
Wait,
balance.
I don't,
No, I don't think that's,
What-
I don't
what
think
were
that's
the hours,
factual.
KG?
he's
Total?
working 10 hours,
30
yeah, so he's
hours.
working 10 now.
He's working 10
Oh,
hours,
no,
we asked
no, he's
20
working
hours.
more
What
than
about
that.
15?
Okay.
So
He's
10
working
to
like 15. He's working 15 now.
Okay,
And we're
He was
talking,
working 10 and we increased him to 17.
that's internal problem, but what we need is overall,
That's
whatever
what it
Tom's
said.
working
That's
is
not an
additional
increase in
20
the bu-
hours.
But
We're
what
asking
we're,
20 hours extra, that's
what we're
what.
talking about now is not an increase to the general fund budget.
Correct, but we need to keep
So
that,
let's,
keep that
so I
information
think
there
maybe
so
we
that
should
it
vote on
goes with
this
it.
well,
and then do the revolving.
well, see, that's what I wanted to make clear before, because I think we're all on the same page, I just don't think we're on the same bus. You've got this in the budget.
Yeah,
We're not saying take it out of our budget, we're saying take it out of our revolving
Well,
fund.
and that's why you have.
Yeah, it
both.
is
It's just to
asterisk,
show
but
you.
it's a little
I would
vague there.
keep, I would make it
Yeah,
a totally separate
it should be
column.
like under here as a
That-
separate.
that can
Like
be
a,
a
like a
second motion to
subcat,
do
like a
that too.
I was
subcategory.
thinking of that, but I said, I wonder
Yeah,
if they
it
want to
should
see
be-
both.
it should be
lines
added
together.
here.
Yeah, make it a
So
subcategory,
we pull it out
because
and
we're
then
not
we go
asking to
through.
increase the budget, we're
Yeah.
saying we're gonna access our,
This says to the total for FY 20 general fund staffing, and that's, it's not general fund staffing for those two.
Right, and that's the line up above, it says total note 34,434.
I know, but this here says total from FY 20 general fund staffing,
Yeah.
206, that's not accurate. These are not, these two need to be taken out of here,
Why aren't they accurate?
because it's not general fund. The
Oh,
revolving accounts,
revolve.
No, the revolving
Yeah,
accounts,
I don't think that
revolving
accounts.
fund
I
is
don't think
removed from
number's
that.
in there, yeah.
The
they
revolving
shouldn't, they
fund
shouldn't be
is.
up here if they're.
No, I agree, you're right.
Yeah, I'm
You're-
taking it
you're right.
out, no, but
You're
the,
right.
the
Well, John-
line up
Completely
above
right.
shows the total.
And that's, I think, the
with the
problem is
revolving.
that it's not clear that
Right.
this
Bring
number
that
is
down
accurate.
here,
Right,
it isn't, so,
Yeah.
206, 306 is the amount without the revolving fund.
but is that revolving fund, revolving account accurate? And I don't think it is, not because it's, because to KG's point, is it gonna be 35 hours? Because it doesn't,
Well, yeah,
if I had
John,
to, if I-
even though you put it in, you're getting more money out because you're going to collect
Well, that's
revenues
a- and it's,
incoming.
and in turn, that's a Michael Herbert decision anyhow, so.
Right.
it-
That's
If
interesting.
we do, if we say he's gonna do 20 and he does 17 and we do 35, it's not gonna matter to anything
Yeah.
right now.
I just wanna make sure we're reporting the numbers correctly, though, that's all.
Oh, absolutely.
Right. So we'll take that rate, 36, 41 times 35 times 52. So that's the number we're chasing.
For the assistant, for the food inspector?
Yeah. So if you,
It's
So-
66 versus,
so you
here
take-
it says 32.
you take, I just wanna make sure we're all on the same page.
Mm-hmm, thank you,
30,
John.
3641
Times
Right.
one.
times,
30.
no, 35, right?
Oh,
35.
the
We're
total,
doing
okay.
10 now.
Yeah.
We went from 10 to 30,
Right.
So that's a week
okay.
times
Yeah, we're talking $66,000.
total,
Hmm.
total.
You won't have that in a revolving fund.
Right.
Just make sure we're doing it right.
Yeah.
This is
Without
what we're
disclosing
voting.
public.
Pull this out of here.
I agree, I
Yep.
agree.
Just make a new
Times
section
35.
revolving account, put the
That's a
food
week.
inspector and add the numbers in.
Yep,
35
and
is
then
not gonna work.
also,
It's not
does he
gonna work.
have
We
a
don't have the
tobacco
money.
agent here?
I wasn't
I
doing
don't
it
think I didn't see
35
it
a
in
week,
there.
I was doing 35
Although
for
that should
2
be,
weeks.
actually, if
Yeah,
we're.
and you should include the tobacco agent position as well.
That's drastically different than what you were proposing,
Yeah.
35 for 2 weeks.
I'll separate the tobacco agent.
That's-
We
that's
need to
why I just-
Subtract the number that he's already at.
Tobacco's
You're saying he's
revolving.
doing 10 hours and we're asking for a total of 30, so if you.
10
just-
hours
Well, look
every
at what
2
he put
weeks?
in for the
Or is he
budget line
doing
He's
item.
10?
doing 10 hours a week to 15, 10 to 15 hours.
Right, so are we really asking for an additional total of potentially 15 to 20 hours?
Correct.
Because
It
if
sounds
you're,
that way,
if you're
but we
putting
don't
in
have
that
the money.
third
Start from the number and
number,
work
then you're,
backwards.
you're at
Yeah.
least a
Double.
third too high.
Right, right.
Well,
Right? We could be
It's
down
double.
closer to 40.
Well, again, when we talked about it Thursday night, I think we were all under the understanding that we had the money. I think that's where we're at. So again, I think it would be something we need to discuss.
But if he's doing 10 now, and we agree that we're not meeting it, not because it's not his ability, because he's a great employee, are we really then gonna go to 20? Or are we going to 35? And I could argue both sides, so. I
Right,
mean- Right.
the reason that we have limited time means that the inspections are not done well, so he may be rushing through some of them where he needs to spend an extra half an hour. He may be cutting short because he doesn't have time.
If we're only doing one
So,
inspection a year, we have
right.
to get up to 2 inspections.
Correct.
We have to get,
Plus,
but,
plus we are also
but-
adding additional probation inspections that we're adding, so we need to get that done
but,
too.
and the but is the biggest point. To
We have
March,
the money.
we don't have the money to do that,
You're right.
unless we go and add this to that.
So
Because I
Thursday,
don't, and I don't think that's wise that we do that myself.
Thursday, we came up with a number that I believe was 36K.
Okay.
If we were on that board, if you have that
Okay.
board, if you can double
I
check.
think it was close to that.
I
Yeah.
believe it was
Yeah.
36K.
I think you're right.
Right? So there's two ways we can look at this, right? We can go, here's the 36K, how many hours does that pay for?
We did, that's what we came up with, is
Right.
36. And right now, he's getting
It
32.
was 36K, right?
Yep.
Okay. So we can go and work back out.
I'm
Now,
doing
if
that
we
right
made
now.
if we made a calculation error, that's a different story. Then we have to figure out what we need.
Yeah, I have him down at
If we're
17.
looking at how many hours we need, and we come up with a number that's drastically different, now we're in a whole different conversation. Now we're in a conversation with, well, we've only got 36 out of the revolving fund, we need to put this X amount more into the budget or somewhere
I don't
else.
think we'll be able to sell
So
it
you're,
because we
you're
won't
looking
do
at
it.
about 19 hours. So if you take the rate, which I don't feel comfortable discussing in front of everybody, but, so. That's a week.
Okay,
Now, keep in mind, but 52, there's where you're at. You're at 19,
And
hours.
I think we may have thought 19 because I think we were talking about also the increase in benefit cost.
right.
So maybe 19 was the magic number.
19 is the magic
Was it a part-time position we were
Right,
referring to,
yeah,
right?
okay. Okay, so,
but see, that complicates it then, because that's 19 all in. That's 19 all in.
See, I had him, just so you know where the number came from, I had him in at, I thought 17 was the
that's
number
what
we
he said he
wanted.
could work up to right now.
Okay, so 17 was, that number there,
It's a
that
different
32,
conversation.
434
32
represents
17.
17 hours a week
Okay.
is what it
So-
represents.
But what KG and I have been
Question-
scheming is
my question
17
is-
plus 17.
Are they,
Oh, okay, well,
are
that-
we,
Right.
We don't have it.
are we forbidden to ask money from the general fund?
Of course we're
Are we
permitted.
forbidden?
Well, we can.
We're not
we,
forbidden, no.
We went,
Oh, then we
you
could
know,
ask for
a
it.
Do it
few
that
years
way.
ago to do
But
the
see, then
revolving
that,
account.
but see, then I think that, not to cut you off, but I think that changes the conversation then, because then maybe you're talking about an assistant rather than a nurse.
No.
Well,
Yeah,
let me-
because an assistant can do food inspections, a nurse can't.
Let me tell you, after
So-
our discussion, we talked about other business and stuff on Thursday, and I second guessed myself. And I think I talked to Mark about it, and I second guessed myself because I'm, some of the things that we're talking about that we really need to help Mark on a day-to-day basis might fall on an assistant versus a nurse. And that's why I wanted to see it, because Mark, doing his homework for us, he might find, because we mentioned Homeland Security, that's a lot of work for him to do right now that could be taken off his plate. We need to look at that, and I think that's what the data needs to represent, is what work are they gonna do so we can know what we're gonna push for.
But we asked Mark if he only had one, and he thought for
Right.
his, or for the town benefit and for him, that it would be the nurse. So I think that's why we went with that. Is that not correct?
Yeah.
That is correct. And
Well, even if
in
that's
a
the
lot of
case-
towns,
still-
they utilize,
You
and
still think that?
I still think that,
Okay.
and the reason I do is because we do have still the food inspector, the tobacco agent, and I can pick up the difference. The nurse would start taking over a lot of the roles I've been taking in place right now, and that, a lot of it's some of the things we mentioned with the promotion, but a lot of it's related to Homeland Security that takes up a good 10 to 15% of my time.
But Chris made that point earlier,
Yeah.
that if you can provide us what having a full-time nurse will free you up to do,
Right, of course,
Yeah, it
then,
would give me
then it gives you that inspection.
Gives me
ability,
that-
yeah.
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 that time I need.
So we have a motion on, I made a motion.
Mhm.
Yeah,
Do
that's
you
right.
want to continue with that, or go, I mean, do you want to go over this and?
Well, are we all?
Because
in
this
agree-
should be-
Does anybody have any questions? Like, are we all on the same page?
Can I just say on the food inspector, that was 17 hours a week is what that number represented.
Correct.
So I'll put out the formula so everyone knows. It was confusing just having a number. And I'm gonna separate all the revolving stuff.
And that, and you feel that would be available
Yes.
in that fund? That's at least attainable.
It comes out to about
Yes, that
32
is
and a half.
attainable.
in the fund.
That is
Would
attainable.
would that guarantee to raise the number of inspections to 2?
Yeah, oh yeah. Not, you don't have to do 2 at the temporaries, that's the only thing, because
Yeah,
it's only
but-
there one
yeah.
day.
Rest of them
But
we need to.
restaurants, and in fact,
But is our employee able?
yeah, he
But
said he could
that
add it.
17
I
hours
had-
is
I had
not
that-
enough to do it.
I had that discussion with him. He said
7
he could
hours
do it.
per week?
It's not enough.
That's adding 7 hours per week. That's
No,
adding,
he already has 15 and he's not able
No,
to
he's
reach.
not.
it.
He's
No.
averaging 10 to 15.
He's been
Some
averaging
weeks
10,
a little higher in the summer with the farmer's market, and so I'd say his average is 12. If
But-
you want, I get you his average.
but that's
hours,
why it's
too.
important that we get from
You do
Mark,
that
if
right
we
now.
add a full-time nurse, adding 35 hours, how does that adding of 35 hours of a nurse free him up to do, and I'm just throwing a
No,
number out
that's
for
good.
conversation, can he do 2 or 3
Correct, that's what I meant.
high maintenance
That with him-
restaurants a week or something?
With
Like,
Mark
would be
and
around
Tom put together, would we reach a
Well,
number
you do
2?
realize I am doing restaurant inspections
are.
right
Yes,
now.
no, but it would free you up hypothetically to
Yeah,
do a
it'd be
couple
easier
more,
to get
right?
them done, and then I do
Right.
new inspection, new construction, so
Right.
I already do food inspections and new food
But
facilities and
if we can get the
questions.
things that would free you up, that
Yeah.
would be beneficial.
Yes,
Mhm, okay.
definitely.
All right, so does anybody else have any other questions other
Yeah,
than?
but I think, John, you need to have a talk to the manager and find out whether he can add additional money into the general fund to get some help with the food inspection in addition to what we have right now discussed.
I don't know that you can add in, well, to the general fund, yes, not into our revolving
No.
account, no.
Well,
not
we,
into
General
the
fund.
revolving.
I mean, we could always have the excuse me, if we increase his hours now and continue it through the, July
Right,
1st.
and then the other
Next
op-
permitting season, we can look at our fees because I remember going to town meeting and asking for a revolving account to fund this position.
Mhm.
I think we're better off looking at our fee structure and maybe doing a little increase to make up the difference versus go to management for general fund, because we really need to sell this $65,000 position. The other two, even though they're important, hopefully they're an easier sell.
Are we gonna be doing that on the 18th, Laura?
What's that?
Looking at our permits for next year?
We have to vote on
Permits?
them.
Oh, right.
Yeah, we're gonna have to
Grease
vote
traps.
on
We,
it,
we
yeah.
can also add
Yeah, the
funding
think we-
fees,
for,
it's all the money's already in.
fees
there,
for
so we
grease
can't-
trap inspection that
Yeah, we don't-
food
Well, there's things I think we could maybe
Oh, but
do
aren't
some
we gonna have to
constructive-
issue our permits?
do these,
Yeah,
some
they've already,
creative
well, we've gotten
thinking
in
about.
the applications, but the
So-
permits will go out
Can
like
you-
around the last
I-
week
it
of
would be
December,
nice
but I
to
don't think
have
we
data
voted on
for
them. I
what
think you
the-
vote
We
on
never,
the,
we haven't.
I think you vote on the
So
grease
that-
traps.
No, that when you're done.
No,
I was
go
gonna-
ahead.
So Diane, can you restate that entire motion now
Sure.
with the
Yep.
knowledge that we're going, if I'm right, with a total of 17 hours for the part-time, an average of 17 hours a week for the part-time food
You
inspector?
wanna
is-
add that.
With that figure at 34 plus being the number that we're looking for?
And
Because
the
I think the
tobacco, I
other two
know,
things you spoke about, everybody agrees
Yep.
on, and now, is that accurate?
yep, we'll go
Okay.
to 17 for the food inspector, and then the tobacco, did we talk about an increase in his? I don't think so, right? I think we,
No,
okay, okay.
no, he's
Okay, so,
too much.
I think we're 98%.
we're doing
And
pretty
Tom
good.
is averaging lower than, because he's now required to not be here every week per his other full-time job. He's probably more down in the 8 hour per week. I'm just looking at some numbers. So that's a substantial increase to the inspectional.
Okay.
But I don't want to increase the budget, and listen, I want Tom to get as much money as he can, but is he able to work 17 hours a
Well, if
week?
he isn't, then he
He's-
isn't, you know.
You guys
we-
already asked him, he said he could work
Said he-
17.
said he could
Defeats the
put it in.
purpose of having this
Said
whole
he could put it in,
conversation.
but he has to take off like every 5th week or 4th
I
week.
understand
Third
that.
week.
Because he's on 3rd week.
Understand.
So that takes away from that week, so.
But I don't want to increase our expectation, and then we fall 7 hours, you know, and listen, I understand he has a life and he has a family and stuff, but I don't want us, this board to think, yep, okay, we increased it, and then we're not meeting it. There's no sense in increasing it if we're not gonna meet
I
it.
think he understands. I had a conversation
Okay.
with him last Saturday, not this past, the one before. So,
Okay.
I think he understands.
So
what
I
we're
can
looking
restate that vote. So would we want to include then, because if it's the third week, he would not be putting in hours for us,
for.
right?
Yeah, so you gotta take that away, so those hours may go down, but if the money's there, we can buy equipment. We're gonna have to buy software. Software is gonna be needed, because they just changed the code, so now we gotta update our software. Another computer, possibly.
So maybe, before we put on the,
So now you're saying that number could be 1/3 less. It could be,
Yeah.
it could be 21
Yeah, if he's
instead
working,
of 34.
Why couldn't you put
In
those
that.
See,
in the
I
capital?
don't feel comfortable with
No,
that.
No.
okay.
I don't feel
but-
comfortable
what I was
okay,
gonna say is,
so-
why don't we not vote
maybe
on
take him out of the
those?
position.
Because
I mean-
the revolving,
His name.
if we don't vote on those and have Mark do a spreadsheet, it would be 17 hours a week at the 3, and then, I mean, if we're talking about software, equipment, and things like that, we need to see
No,
what the bottom
those
line
things, I
is.
think they should fund it from other means, like, you can go to the BAA grants, apply for it, or you can go to the capital project if it is a large amount, ask them to give the funding.
Usually it's under 1,000.
It's-
Software could be more expensive. Software can go up to 8,000 to
yeah,
9,000.
then that's,
But
that's
we're
where-
we're using a program that's under 1,000 right now.
See, the guy who started the BA grant, I would be appalled if we funded, you know, that from the BA grant. And I appreciate, you know, where you're coming from, but the BA grant in my mind is the guy who, like, went and told, you can't have the Boston Marathon unless you give us this. I wouldn't feel comfortable even going to the Board of Selectmen and asking for that. And more importantly, the one thing, and I think everybody, that's why I love all of you guys, is that we're talking about public health here. Public health means everything to everybody, you know, you got a sick parent, you got a sick child, it's the end of the world. We shouldn't be figuring out how to fund public health from grants and all this other stuff. I mean, this is a core value of the community, public health, core value of this nation, it's public health. We can't be funding stuff off of grants. No. If we need the money, let's dig down harder, dig down deeper, and make the case to the public that this is needed. I don't want to talk about grants.
Right, now, and I agree with you, if it's a position we need, it should never come from a grant.
Right.
However, grant money can buy a computer system,
Mhm.
can buy software, can buy things like that for using.
Those are one-time
and-
expenses.
Right, and
Right,
you can
one-time
sell it
expenses.
because it'll help us to implement these full-time things. Now, we've talked a lot about this food inspector, and it's almost becoming obnoxious how much we're repeating ourselves,
Mhm.
right? Let's stop using Tom's name,
Okay.
like we did last
I
week.
agree 100%.
Okay? I think that what we realized is if we had 17 hours, that would work for us,
Mhm.
right? I think it's reasonable to let's presume we're going to fund 17 hours. However, or whomever does those 17 hours is irrelevant today.
Mm-hmm.
If we need 17 hours, or we'd ideally like to have 17 hours in total, then that's what we should be looking at funding, right? Who's gonna do the inspections is irrelevant. At some point, we'll have to figure that out.
Mhm.
Whether it is the person doing them now and someone else, whether it's someone completely different, is not relevant. The question is, do we need 17 hours of a food inspector? If the answer is yes, then that's what we should be putting in on that number. It's irrelevant who
Agree
or how it's
100%.
gonna work.
Agree 100%.
And we're spending a lot of time talking about individuals and whether or not this, and that's just not relevant.
Good.
And I get, and it's all okay.
Agree.
It's all okay to have the discussion, because that's what we do. We vet things out that way. If we didn't have that discussion, I wouldn't have been able to make that statement, right? I
Well,
derived it from the
And I
conversation.
can restate the motion I had, and that's why when we came to talking
Yeah.
about the spreadsheet,
Yeah.
this spreadsheet is irrelevant to go over.
Yeah,
The vote is what we're going to increase.
Right.
And period, whatever the figures turn out to be,
mm-hmm,
right?
Yep.
mm-hmm.
Okay.
Yep.
We ready?
Go for it.
This was good. This is
Yep.
good. So please.
I make a motion to have Mark Oram submit a budget of an increase in overtime for administrative secretary in $2,300, a full-time public health nurse increased to $65,000, on-call coverage in the amount of $2,000 and an increase in the food inspector's hours to 17 hours per week out of the food revolving account. And for John Featherston to review the documentation before it's submitted to the finance director.
I second that.
Further discussion? Seeing none, all in favor? Aye.
Now, Mr. Chairman, can I say something? Now you take that
One
vote?
second, just before you,
Just
I
one
was just gonna
second,
say-
because I just have one, because I think we gotta put a time frame
you
on
got
that,
another
though.
vote, though, you need to, are you gonna vote our salaries in? Or are those
We just
assumed?
voted the increases.
Oh, okay, you're not
Those
voting
were
the
the
salaries or, okay, everything else stays.
Because
Everything
the
else
same.
stays the
Okay,
same.
that's fine, just wanna make sure.
I
You
don't
might
know
not
if I
have two
to
staff
adjust my
people
motion,
after
'cause I didn't say
tonight.
anything about tobacco, because tobacco would be level funded.
We're not changing it, so,
Right.
these are
Okay,
just
Okay, I
changes.
just wanna make sure.
I'll separate the revolving funds.
All right, so, I don't know that we need to take a vote on this, because we have, when are we gonna do this? We're gonna do this by the end of the week, we're gonna do
I'm
it by
doing it
Monday?
right now, actually. Changing
Well, I
this.
was
up.
Well,
gonna say,
I'm-
wait
but
until
I-
after the meeting, so we don't miss anything.
But, yeah,
Yeah,
'cause,
no, I agree, yeah.
I mean, if
You
you
can
could,
do it
if you're
tomorrow,
gonna,
Mark.
Yeah.
why don't you do it tomorrow, send it to me, I'll call you around lunchtime or in the evening,
Yeah.
and then we'll submit it
Okay.
Thursday then.
Yeah.
Does that sound good?
Reasonable.
Does that sound okay. I don't even know what day it is. Okay, it's Tuesday. Okay. You had a question, Mr. DeSoni?
It took almost, 45 minutes to get that far. And I appreciate hearing it. But I'm just gonna come out, really say straight out, numbers cannot change boots to the ground to get the duties going for each one of them. Through the whole board and for what you just voted on, without saying the names and stuff like that, but how many bodies are going out there to do the jobs? For what you just passed? If it gets passed by the budget, no people.
Well, essentially, it'd be four.
Well, it would be an increase in one position.
Right, one position, well, one
Which
position.
still
and
bodies
hours
here.
for another.
The
One
body's
personnel.
here.
One,
Right.
yeah, one.
And those,
25% increase.
and those hours, is it gonna be regular business week hours or add on emergency hours?
Say.
Yes, I don't think we could specify
I
that.
don't think we're there yet, Mark.
Okay?
Oh, you're talking about the,
I don't think nurses can be 9 to 5.
I was gonna say, you're talking about the public health or the food inspector, Mark?
I'm talking about all three that you just had the motion on.
Well, one of them's administrative. One of them is on call for like special occasions, so you hope that special occasion never comes. The public health nurse, to KG's point, I don't think is a 9 to 5 position, but it's a 40-hour position because it's municipal government, it's 40 hours. We'll figure out how to, we'll dice that up. And then the other one is increasing the hours of an already existing employee.
And he's already doing beyond 9 to 5. The
Okay.
inspections he's doing in the night, as far as I know.
A lot
Mark,
of
if I-
inspections are done on the weekends and off
Weekends and
hours and
evenings.
stuff, yeah.
I think Saturdays, not on Sundays. I think.
If I may address, Mark, I think the way to look at it is, we realized, I'm going to use a box of cereal, right, as a kind of an example. You buy a box of cereal because you need a box of cereal, but you don't sit there when you go buy the box of cereal and say, well, on Monday, I'm going to pour 2 bowls of it, and then I'm going to give 3 bowls of it here. You just know you need what's in the box of cereal. How you're going to apportion it out isn't important at the time you're making the purchase. You just know you need that quantity.
That's
Right.
right
I
now.
like the way he says.
That's
I-
great.
I like
And that's,
that
and that's what
analogy.
we're doing right now. And that's where we're at. And I appreciate your input and feedback, but we got to buy the box of cereal first, because we need it.
And
How we eat it, we'll figure it out as our needs change.
And to say that box of
Boy, that was
Cheerio,
beautiful.
to say,
I know, huh?
to say that box of cereal,
That's why he's in school.
are you gonna, you want that box of cereal on, that has a good, fresh date, or you gotta wait till late when it's stale?
Well, the good part about the box of cereal we're going to buy is it doesn't have an expiration date.
Then you gotta buy it straight from the ground
You
then.
guys are making me hungry.
Yeah, really, I was gonna say.
I'm
let's
using
go.
food because we're talking.
I know.
All right, so,
So I'm basically gonna just to say, As it said in Mr. Oren's office, public service is everybody's business.
There you go.
Thank you, Mark.
All right, so you and I will talk sometime tomorrow.
Yep.
Or Thursday, and then we'll get that done. All right.
Good.
All right, so we all good with the review of the budget?
Yep.
All right, so let's go to review of minutes of our November 20th, 2018 meeting. And does anybody have any questions or concerns? Still think these are the best minutes in the business.
I agree.
Laura?
I agree.
No changes?
No change? Would you like to make a motion?
I move that we accept them as submitted.
I'll second it.
Oh, right,
You, okay,
We have a consensus on a second?
yes.
Further discussion? Seeing none, all in favor? Aye.
Aye.
So that's a 5-0. Discuss future agenda topics and meeting dates. I know we talked with the attorney that was here tonight. I am planning to go to the Needham meeting next Wednesday. That's at 7. I could probably get there by 7. Needham's not the most convenient place for me to go, but you're thinking about going, right?
Yeah.
Is anybody else thinking about
I
going?
may. I'm
Should
not
I
sure.
post
Yeah, I think so.
at an err on the side of caution?
I'd like to go then, if
Okay.
you're gonna do that, for sure.
Yeah,
Okay.
we can just post and just
We'll
post
just
their
post.
agenda.
We'll post.
Yeah.
And then, we'll have to, if we are posted, then we'll have to, call the meeting to order. And then we'll have to take minutes, which is fine. And then, if we speak, then we do have to acknowledge the fact that we are in session.
And not to, I don't wanna hold the gun to anybody's head or talk about something we shouldn't, but what are you have any thoughts and feelings about exactly what he said? And, or is that something that we have to potentially ask Cheryl Sabar about?
Well, I thank you for asking that, because I think that's he came here tonight with a very distinct
Yes, he
message.
did.
And when I called him on it, he was like, okay,
Right.
yeah.
It's clear.
It's clear,
Right,
yeah.
Absolutely.
It's clear.
Yeah.
It's clear.
Right.
But also, right, look, he's a lawyer.
Yep.
Right,
That's
understood.
what he
He
gets paid
knows
for.
where we are in our process. He was using scare tactics.
Right.
Yep.
It doesn't scare me.
I did,
Oh,
I did some research,
but
because again,
It
some of
actually
it's-
emboldened me.
well, so some of it's new to me, and I did some research, and
Yeah.
that was actually, about, segregating, a certain population was concerning to me.
Mhm.
So that's, he brought out the point that I.
Right, that's a good point, right. And
Right.
then so I do agree with
Because
his
this-
unintended consequences of that.
Right, and again, it wouldn't be intentional, but
Correct.
it's a fact.
Understood.
Apparently, again,
Correct,
doing some
understood.
research, that's a fact, and that has been widely publicized. I didn't know.
No, absolutely.
I mean, I thought he brought up a
Nor did
good
I.
point about, I'm interested to hear what the Needham Police Chief is gonna say about, you're gonna write tickets for, you see some, 18-year-old kid smoking a cigarette on the basketball court up at, Stone Park,
See, I like that perspective of it, because I am currently not in favor, and of course, it doesn't have to be unanimous, not in favor of moving forward with that, because they shouldn't be in possession of them anyhow.
Right.
That's the bottom line, and
Yeah, but that's I mean, you have laws, but then they need to be enforced. I mean, it's like saying, I'm not gonna wash my hands because they're gonna get dirty again. Well, because that's a poor argument to me. Everybody knows the harmful effects of cigarettes. And our whole goal is to
right,
keep
and
them
that's
out
why
of the
we
kid.
changed it to 21.
Right, exactly.
We, the town.
But, right, and if the world was perfect, then we wouldn't even have to sit here and talk about it,
Right.
because everything would already be obeyed.
Yeah.
But just like people get what they want to get,
Yeah.
and kids find out how to get it as well. But if we can do one other thing to prevent them from getting it, that's what I think we're looking to do. We're not looking to be discriminatory, so that's that fine line we gotta ride between, saving somebody from what happened to Mary, unfortunately, because they didn't have enough information. Now we have all that information.
There is
and,
precedent.
just because I can tell you, Mary's looking down, because she smoked menthol cigarettes,
Yeah.
and she would be very upset sitting here thinking that the town would actually ban the type of cigarettes she smoked.
Yeah.
Because she has, even though she knew and sat here, knew it was not a good habit, and we all know, it was her right
See, I would
to go
think-
to the local convenience store and buy a pack of
Right.
cigarettes as a grown woman.
Well,
Right.
there's some precedent too for it being difficult, right? So we banned soda from the schools, right? But we banned all soda. We didn't pick
Right.
Coca-Cola or
Right.
cola flavors, right, and leave the others, right? You can look at soda flavors, and there are certain soda flavors that are consistent with certain ethnic groups.
Right.
Right.
That's absolutely a fact,
Right,
right? But we banned all soda.
right.
Right? So now if we say we're gonna ban all tobacco from our town and be a dry town for tobacco, that's a different story. They don't have a fight.
Nope,
Correct.
But if we are picking and choosing,
but you do pick a fight, though.
right,
Right.
then.
The
then
retailers, yeah.
then-
And I know
then-
that is the
right,
nature of the business.
Yeah.
That
So-
we're not gonna make
So
everybody
it
happy.
is.
You know,
but-
Again,
I would think that Mary would be exactly opposite, that if she said that she liked menthol cigarettes, but that if there wasn't menthol in those cigarettes, that maybe that would have prevented her from smoking and unfortunately having to deal with the side effects that came along with not just smoking menthol, but any cigarette, that, to me, she was more of a staunch supporter of all these regulations, unfortunately because of the detrimental effects to her health that it had.
Right, right.
And I see it maybe as she was younger, her saying, well, you know, I should be able to go buy this, you know, as I darn well please, but, you know, we send kids over to get killed in wars, and they can't have a drink yet.
He
You know,
did
how
bring
fair
up
is
a-
that?
he did bring up a point though too, which I don't have factual evidence for it, but I feel like I've read this somewhere, that menthol cigarettes, one of the uses of smokers, lifelong smokers, step down to menthol cigarettes in hopes of eventual quitting. It's a transitional product. Now, I don't think there's any evidence that
Okay.
it works,
Yeah.
but I would bet that there probably is some evidence and that's something that maybe I can shoot an email to Amy to see if she has any information on.
That'd be good.
Yeah.
Well, and just so the board knows, at that tobacco meeting I was at, Metro West Health Foundation's doing work on this as well. And the 9 communities were at that meeting, and I can update you at the next meeting. I know it's not on the agenda, but one of the people presenting said menthol was put into cigarettes to prevent the harshness
Yep.
of the inhale.
Amy mentioned that when she was here last time.
Yeah.
And
Amy
that's
was
where
at that
that's
meeting,
where the
too.
evidence, that's where the evidence leads to, that people starting smoking a mentholated or flavored cigarette are easier to get addicted because the initial shock is lessened. So,
All right, so I'll work with Laura tomorrow or the next day to post for next Wednesday at Needham, 7 PM. I'll Google map it, send everybody the directions. You'll be there, maybe? No?
Maybe.
Maybe, okay. I'm gonna be coming from work, so it doesn't make sense for me to come back here, but does it make sense for you guys to carpool
I'll
or
do the same thing.
do the same? So we'll all meet individually? Okay. All right, and then, so we'll post for that, and then we meet again on the 18th, is that correct?
Yes.
Okay.
So we'll approve all the annual licenses, right?
We don't do that.
Just the grease trap.
Just the grease
Just
traps,
the
right?
grease.
Yeah, just the grease trap. And we'll follow up on your, and then, do we have anything else looming for year end?
Probably look at next year's schedule, as I mentioned earlier, January, the first Tuesday is New Year's Day, so we may have to look at a variable schedule for January,
Okay.
if, you know, especially if we.
Right, but we don't have any looming topics that need year-end
I
review,
think
right?
regulation review will be a topic, you know, see where the board wants to go with.
You know, if we could, I mean, it's a
Tobacco.
busy time of the year for everybody, so if we can keep the agenda short.
Maybe we can just keep going with the budget.
one thing, though, and I mentioned it earlier,
Don't, see, I get John between.
Mark, if we are gonna talk about fees,
Yes.
if you can bring us some comps, surrounding towns'
Okay,
comps.
sure. Let me make a note of that.
One thing that I might suggest, and I wanted to bring it up last Thursday, but then we just ran long last Thursday. With my departure from this board, I think it might be wise if we do a board reorg and I work more as a mentor and somebody else become the chair of this board, so you're ready for next year. And I'm kind of looking at you. Just a suggestion. I mean, do you guys think that's a good idea? There's a lot more than goes on, and luckily Laura is like the
Yeah.
easiest human being
I
in the
would
world to work
suggest-
with, but,
I think it's certainly something we can entertain talking about, but I would suggest we look at maybe the late January or early February meeting for that.
Okay,
There's, I think with the holidays and the stuff on our plate in the next few weeks with the budget, I just think it's too much to,
Okay.
And if I could, I'm thinking the same thing about the fee schedules. I mean, we kind of put a lot on Mark for the next couple of weeks for the
Okay.
18th. Maybe we
Yeah.
could do that as well, just put the fee schedules off until January, because it won't be effective
Yeah, I
until
wasn't gonna
next
do it.
November.
Yeah,
I just want to
didn't
say,
wanna- No, I'm
just,
okay
I mean,
with
I
that.
wouldn't concentrate on that
no,
right now.
I'm
because-
okay with that for sure. I
okay.
Yeah,
thought,
the
I
fee
thought we
schedule-
were doing it because we had to.
The fee
No, the fees
schedule-
were already collected for this year.
Oh,
So,
okay,
but
yeah.
And a fee schedule's a regulation, so you have to
Okay.
pass it as a regulation. Fortunately, as Diane knows from the years past, our fees were based on overhead,
Crazy.
time to do inspections, and then it's easy, we just add a percentage to it, like 5%.
Yeah. But, you know, I
It will
I
be-
think, I
yeah.
think
We'll look at
important-
comparables.
But
We're pretty high
What's,
in the
what's
area.
important with comparables, I think, is that, you know, if we're asking a business to establish themselves in our town, and we're charging them more to be, for the privilege of being in our town.
Well, we're not
we're-
charging for a privilege, we're charging for a user fee.
Okay, and I
No, but
understand
The
that.
other towns unfortunately have not done the exercise we did.
Mhm.
And we did it for that
Yeah.
reason, so we're not overcharging or
Right,
undercharging.
and-
But,
okay,
but just to add to that too, is it was discussed at that tobacco meeting.
Right.
And we're close to other towns now, cause they
Yeah.
came up to where we
Right.
are.
and that's
There
fine,
was a suggestion to do that, cause towns were charging a nominal fee of 25.
right.
But then again, maybe they don't have the services we have.
I have no opposition to fees if we can
Yeah.
justify them,
Sure.
but what I do wanna make sure is that we're not pricing people out of.
No, I
Right,
don't think
right,
we are.
right.
We haven't
Right,
had
some of
many
them need
people
money
saying
adjusted
that.
down.
Some of
the
these
internet said it.
businesses, when you charge a fee, they tack it on to the customer anyway.
I understand
So
that,
that's because
I understand that.
that's their overhead, so they'll put it on the customer, so it's not
Mhm.
the
True.
owner's paying or
Right.
the businessman, it's the customer
Yeah.
who's paying
Cigarettes.
extra money.
I hear you.
Well, one thing that I think, and I want to applaud the town, and especially the selectmen and the management of the town, of what I think was a hugely successful town meeting a week ago today, or, right, it'll be a week tomorrow. But what happened at town meeting was a wonderful thing, but I also think it potentially changes the town, and I think it changes the town for the better. And we're talking about adding a position, but we're talking about a lot of important things, you're putting a solar array on a Superfund site, which is it's like heaven, you're turning a negative into a positive. But there are some ramifications that, public health concerns, and I don't think it's dangerous to do it, and I know it's gonna be done right, and, were any of you at the Citizens Energy meeting that we had? Because the Nyanza group met with the Citizens Energy Committee. One thing that I mentioned to the lady from Citizens Energy, and that's Joe Kennedy. Joe Kennedy runs Citizens Energy. And I'm like, well, do you know the piece with his uncle? And, I forget her name, very nice lady. She's like, I have no idea what you're talking about. I'm like, well, Joe's uncle, Ted, made Nyanza happen. I mean, so that was a wonderful story. Wonderful, wonderful story, His uncle made, and now the nephew's coming in and building a huge solar farm on there. My point is there's some things there, and I was a little surprised that, the day before town meeting, the Nyanza Action Committee had met with the town manager and talked about all of this, yet this board hadn't met and talked about that. So, I'm a little concerned about that. It's not a criticism, it's just acknowledgement. You're gonna be building new housing up there, you're gonna be building new things up there, there's a new Y coming in. Y to me is public health. So I think a
It's
lot
great
of
stuff.
wonderful things happened at town meeting that this board needs to, I think, get in the trenches a little bit with. I mean, it's gonna be a couple of years before the Y's built,
Oh,
but,
yeah.
Probably
But-
good justification Mark's gonna have things taken off his plate.
Right.
Other things will be taken over. So
Exactly.
even with that said,
You know
maybe
it-
that would be good to put that on your list of the
Increase with
things that
the-
we know that are coming.
right. So as proud as I am as this board of, we have new regulations, we have new policy procedures, and we have goals this year, I think it might be good to come up with a 6-month, a year, and a 3-year plan for this board, as you guys are transitioning, because there's a lot of, one, your population's gonna change. I was joking with the police chief, I'm like, your traffic's gonna change. Your traffic's gonna change, and that's a public health concern right there, because I don't know if you guys drive through town anymore some mornings, if you don't get out of town in time, you're late to work on time though. But I think it would be good to come up with, in just my recommendation, a 6-month, a 1-year, and a 3-year plan for this board, where do you guys wanna be? Plus, we also we're coming up on our public health nominee for the year too, so that's something to think about too, so. Just a couple items for the next meeting.
It's always a good idea to plan ahead, that's for
Yeah.
sure.
Yeah.
Motion to adjourn?
Second?
All in favor? Aye.
Aye.
Thank you and good evening.